we have discussed the different segments of anatomy that you have to learn in your 1-year course, namely the gross anatomy. Gross anatomy will be dealt with in the lecture class as well as in the dissection class. Then there will be that element microanatomy or histology that will be dealt with in the morning practical class 11 to 1. There will be a practical class each day. Students, 150 students will be divided into 3 batches for that practical class. Each batch will be having 2 classes per week, 11 to 1. There will be a practical class in anatomy department. Each day, 50 students will visit the anatomy department between 11 to 1. And in that class, histology will be discussed. Histology means initially there will be discussion about the different tissues and you will be shown some of the slides belonging to the different tissues, and then your teachers will move on to the organs, to the organ systems. So each batch will be having 2 classes per week. So you have to buy or procure a histology lab notebook. You have to draw the diagram of the thing that you are finding in the slide, and you have to write a few things about the structure in that practical notebook. And after each day, you have to submit that practical notebook to your respective teacher. That practical notebook will be carrying a few marks for your practical examination, university examination. সেসব স্যারেরা বলে দেবে। আচ্ছা, as for gross anatomy you have to put maximum thrust upon gross anatomy because gross anatomy is very extensive. The structures in the human body as we see them with our naked eye, that is huge and extensive. That will be dealt with in the lecture class as well as in the dissection class. There will be 4 days, dissection will be 4 days. Probably in the routine you will find dissection Monday, Tuesday, then Thursday, Friday. Each day during these 4 days, each day the time allotted is 2 hours. 2 hours time will be there for dissecting the part of the human body and see the structures over there. After dissecting and seeing the structures over there, during the class, your duty is to open up your books and read while you are in the dissection class. Then again, in your hostel room or in your home, you have to read. That is gross anatomy. The gross anatomy dissection class is very important. Remember that dissection class is more important than the lecture class for gross anatomy. Then after that there is embryology. Embryology will be dealt with only in the lecture class, and you will find nothing practical for embryology in anatomy department. So in the lecture class, teachers will be telling you the things, how the human being within the mother's womb grows and develops from a single cell. In yesterday's class we have said a few things only, so that will be dealt with. And probably in each week there will be 2 lecture classes in embryology. 2 করে lecture class থাকবে in each week for embryology earmark করা। That is more or less the thing, how we will schedule the different segments of anatomy. In today's class I will be discussing altogether a very different segment. This segment is being called as general anatomy. This general anatomy, it is general. General বলছে তুমি, তার মানে তুমি বুঝতে পারছো this word encompasses so many things. General anatomy. So you have to buy a general anatomy book. Which author you have to select? You go to the library, central library, you will find books on general anatomy. You see the books, then you decide. Because general anatomy books, you have to know the general anatomy topics. What is meant by general anatomy? What are the subjects that are being covered in general anatomy? That you have to see first, and how the thing is being presented in that book, whether it is palatable for you or not, that you have to decide. ঠিক আছে? তারপর একটা বই কিনতে হবে, ছোট মতো বই, 100 to 150, খুব বেশি হলে দাম হবে, নট মাচ, কিন্তু বইটা কিনতে হবে। আচ্ছা, আমরা যে বইটা পড়তাম, but the best book available in the market is obviously AKD's book. Asim Kumar Datta is a pioneer in writing the first book on general anatomy. But Asim Datta's book is too extensive for you UG people. তোমাদের জন্য কিন্তু একটু বেশি বড় মনে হতে পারে। আমি জানি না রিসেন্ট এডিশন কি হয়েছে, হ্যাঁ, একটু এক্সটেন্সিভ মনে হতে পারে। কাজেই অসীম বাবুর বইটা AKD's বুক যে পারবে কিনতে পারো, তার কারণ তুমি ওখান থেকে তোমাকে ইউ হ্যাভ টু চুজ হাউ মাচ আই উইল রিড and what I will skip, that you can decide. ঠিক আছে? ওটা খুব এক্সটেন্সিভ বুক, বাট that is a very good book. ঠিক আছে? আমাদের যারা পিজি করে অ্যানাটমিতে, they used to read that book, Indian textbook. If they read any Indian textbook, they will select AKD's book. ঠিক আছে? তো AKD বইটা এখানে মনে হয় আছে, আশা করা যায় তুমি সেন্ট্রাল লাইব্রেরিতে পাবে। তা এটা তুমি লাইব্রেরিতে রেফারেন্স হিসেবে ইউজ করো, বুঝেছো? কেনার জন্য ইউ সিলেক্ট এ স্মল বুক। ঠিক আছে? স্মল বুক অনেক আছে দেখবে তুমি, দ্যাট উইল ডু ইউর পারপাস। ঠিক আছে? তো জেনারেল অ্যানাটমি ইজ রিয়েলি in the general anatomy book you will find something related to histology or microanatomy. There will be topics related to microanatomy. The things that are being discussed, you can pretty well appreciate that they belong to the histology segment. Again, as you are reading the general anatomy book, you will find something which has got nothing to do with microanatomy. That is really gross. So in general anatomy, there will be overlapping domains of histology, gross. But the idea will help you to appreciate finally the huge gross and somewhat smaller in volume the histology. ঠিক আছে? কাজে জেনারেল অ্যানাটমি কিন্তু পড়া উচিত বলে আমি মনে করি। একটা করে বই কিনে নিও, খুব বেশি দাম নয়, ছোট বই একটা কিনবে, and for reference you use AKD's book. So general anatomy in the book you will find a little bit discussion about the cell. ঠিক আছে? Cytology. So that I will not discuss today. Or about the cell we will not discuss anything, because we think that in your +2 course you have read about the cell. At least you know something about the building blocks of life. We will not go into the details of individual cellular structure. আমরা কিন্তু যাব না, সাইটোপ্লাজমিক অর্গানেলিস, নিউক্লিয়াস ইত্যাদি নিয়ে আমরা কিছু বলবো না। But be sure there will be discussion about the cytoplasmic organelles, the nucleus in the biochemistry class. কাজে biochemistry class থেকে you will be getting plenty of inputs regarding the cellular function. বুঝেছো? And the function is all that matters. Ultimately the cell has to function. ঠিক আছে? It has to do its work. কাজে functional aspect যখন স্যারেরা বলবেন, obviously the teachers will be telling you the structural thing which will deliver the function in the cell. কাজে ওখানে biochemistry class plus physiology people will tell you something that will do. So let me tell you first what are the tissues that built up the adult human being. Adult human anatomy, what are the tissues that we find? Can you name the 4 basic tissues that we find in the human body or in human anatomy? 4 basic tissues, name. Yes. Bolo. Epithelial tissue, connective tissue, then muscle tissue, then nerve tissue. ঠিক আছে? আমরা নিউরাল টিস্যু বলি না, নার্ভ টিস্যু বলি। তাহলে these are the 4 basic tissues that will be there in human body. In some places they will be together, giving rise to an organ. In some places we will find them, we will find some of them, ঠিক আছে, not all of them, ঠিক আছে। এই যে চারটে বেসিক টিস্যু বলছি, এই চারটে বেসিক টিস্যুকে আমরা সব জায়গায় যে একসঙ্গে চারটে গিয়েই দেখতে পাবো in the construction of a structure or an organ, তা কিন্তু নয়। In the organs, namely, যে অর্গানগুলো তুমি দেখতে পাবে in the different systems, in most of the places, in most of the organs, you will be finding all the four elements: epithelial tissue, connective tissue, muscle tissue, and nerve tissue. But in some of the organs of these four tissues, one or two may be missing, ঠিক আছে, বাকি টিস্যু থাকছে। And in the structures that you will encounter, organ বাদ দিয়ে, organ system আমরা যদি মানে organ system as such যেগুলোকে আমরা ধরো স্পেশালি বলি, অনেক কিছু organ system আছে, আমি এক্ষুনি তোমাকে বলছি। In the limbs, we don't find anything related to GI system, we don't find anything related to respiratory system, we don't find anything related to excretory system, পাই কি? কিছু পাই না। তাহলে limbs predominantly আমি কি পাই? The framework of the limbs is being built by none other than the bones, you know, ঠিক আছে। খাঁচা যেটা, ঠিক আছে, the frame is being built by the bones in the limbs, in the upper limbs, in the lower limbs. In the trunk again, the frame is being built by the bones. In the head and neck region again, the frame is bones. তাহলে in the limbs you are getting the bones. After the bones, what you are finding from inside outwards, I am telling you, ভেতর থেকে বাইরে। তাহলে first the frame, the skeleton, upper limb skeleton you will find. Then what you will find? You will find the soft tissues. Collectively we call them as the soft tissues. What are those soft tissues? Soft tissues are muscles, soft tissues are vessels, soft tissues are nerves, ঠিক আছে। তাহলে you are finding a basic tissue in the limbs in the form of muscles. You are finding another basic tissue in the limb in the construction of its frame, which is nothing but the bone. So bone belongs to which group of tissue? You all know that belongs to connective tissue, ঠিক আছে। Now bones and cartilages are grouped together in a form which is being called as the sclerous tissue. It is a specialized form of connective tissue. No doubt it is connective tissue, but it is a specialized form. তাহলে it belongs to the connective tissue. তাহলে in the limbs, in its core, you are finding the connective tissue in the form of bones, ঠিক আছে, sclerous tissue. Then outside the bones you are finding the soft tissue element, the muscles, vessels and nerves. Nerves obviously belong to the nerve tissue. Muscles, they belong to the muscle tissue. But what about the vessels? Tell me. Vessels belong to which group of tissue? Now here comes the role of embryology. এখানে কিন্তু তোমার এমব্রিওলজির রোল আছে। তুমি যখন এমব্রিওলজি যখন পড়বে, জেনারেল এমব্রিওলজি, from your embryology knowledge you can pretty well answer this question. Vessels are derived from the embryonic mesenchyme, which is nothing but the embryonic connective tissue. বুঝেছো? embryonic connective tissue কে বলি আমরা mesenchyme. This is nothing but embryonic connective tissue. This mesenchyme will give rise to so many tissues and organs in the human body, and you will know in future what are the things that will be derived from this mesenchyme. So one such thing which is being derived from the mesenchyme is the blood vessels. বুঝেছো? তাহলে এই mesenchyme থেকে একটা জিনিস আসে, blood vessels. তাহলে blood vessels obviously in adult anatomy they do not fall under the group of connective tissue. অ্যাডাল্ট অ্যানাটমিতে কিন্তু ব্লাড ভেসেলসকে আমি কানেকটিভ টিস্যুতে ফেলতে পারবো না, ঠিক আছে, বাট দে আর ডিরাইভড ফ্রম দ্য এমব্রিয়নিক কানেকটিভ টিস্যু, ঠিক আছে। তাহলে দিস আর, ইউ ক্যান লুজলি সে দিস আর এলিমেন্টস অফ কানেকটিভ টিস্যু, ঠিক আছে, কিন্তু তুমি কিন্তু অ্যাডাল্ট অ্যানাটমিতে বলতে পারবে না, ইউ হ্যাভ টু সে দ্যাট দিস আর দ্য ব্লাড ভেসেলস, ঠিক আছে। নাও ইন দ্য ব্লাড ভেসেলস which group of these four tissues will be assembled together? বলো। In the blood vessels as such, সেটা that might be an artery or that might be a vein. Which group of these four basic tissues will be assembled together to give rise to a blood vessel? আমি তোমাকে দেখিয়ে দিচ্ছি, দেখো। Say for instance, this is an artery, this is the cross section of an artery, ঠিক আছে। Now while drawing an artery like this is a very simplified diagram, ঠিক আছে, this is a very simplified diagram of a blood vessel cross section with a lumen within. Now I can elaborate upon the structure of this blood vessel, যেটা তোমাকে করতে হবে, because you are now reading human anatomy, not biology, ঠিক আছে। এবার দেখো, ইন দ্য ওয়াল, এই যে আমি সার্কামফারেন্স অফ দ্য সার্কেল আমি যে এঁকেছি বাই রেড কালার, দিস রিপ্রেজেন্ট দ্য আউটারমোস্ট কোট অর টিউনিক অফ দ্য আর্টারি, outermost coat or tunic of the artery. Now this is made up of, in the adult, this is made up of fibrous tissue, this is made up of fibrous tissue, means connective tissue. নাম কি? এটার নাম হচ্ছে outermost coat which is made up of fibrous tissue. এটাকে আমরা বলি adventitial coat, adventitial coat or tunica adventitia. Tunics means coats, তাহলে it is being called as tunica adventitia. তাহলে we are finding the connective tissue is there forming the outermost tunic of an artery, and this tunic you will find in the larger vein also. এই টিউনিকটা তুমি পাবে in both group of vessels. Then we will find an assembly of muscle tissue, an assembly of muscle tissue like this, an assembly of muscle tissue in the wall, an assembly of muscle tissue in the wall. Now this tunic is being called as the tunica media or the medial coat. This is being called as tunica media. Therefore we are finding the muscle tissue is being incorporated in this structure, this very simple structure. এটা তো একটা খুব সিম্পল স্ট্রাকচার, একটা ব্লাড ভেসেল, তার ক্রস সেকশন দেখাচ্ছি, but you are finding assembly of already two basic tissues, the connective tissue and the muscle tissue. Then finally lining the wall of the lumen, এর ভেতরে যে লুমেনটা আছে, ঠিক আছে, lining the wall of the lumen অথবা innermost coat will be a layer of epithelium, a layer of epithelium. Now this is being called as the intimal coat or the tunica intima. Now here the cells are organized, the cells are in an epithelial organization. তাহলে আমি epithelium পেয়ে গেলাম, the cells are lying side by side, the cells are in a single row, একটাই রো আছে. Now this type of epithelium that we are finding lining the lumen of an artery or a vein is being called as endothelium. ঠিক আছে, epithelium, but it is obviously a special thing lining the innermost, lining the lumen, ঠিক আছে, or facing the lumen of the blood vessels. This is being called as endothelium. তাহলে whether we call it endothelium or not, it is epithelium. এ বিষয়ে তো কোনো সন্দেহ নেই This is simple epithelium. The cells are organized in a single row and the cells are flat. ঠিক আছে, তাহলে এইরকম যে ফ্ল্যাট সেলস যখন থাকে পরপর বসে, তাকে আমরা কিরকম এপিথেলিয়াম বলি? From your biological knowledge, you tell me. Yes, squamous epithelium. Squamous epithelium cells will be like these tiles in the floor. বুঝেছো? Scale like, thin, scale like. We'll have all the organelles of a cell, nucleus, cytoplasm, everything will be there. But the cells are flat in the form of scales. Therefore, they are being called as squamous epithelium. Now, since the squamous epithelial cells are in a single row, it is being called as simple squamous epithelium. Now, this is the intimal coat. This is the intimal coat. This is the intimal coat. Tunica intima. Tunica intima. Tunica intima. Now, already 3 basic tissues are there in a very simplified structure like an artery or a vein. Now, the 4th element which is missing here is obviously the nerves. ঠিক আছে, will obviously be there. Nerves are obviously there to have their effect upon the muscles. Muscles থাকলে nerves থাকতেই হবে. Without the nerves, muscle cannot contract. কাজে nerve fibers will be there within these muscles. ঠিক আছে, তাহলে এই মাসেলস এর ভেতরে আমরা নার্ভ ফাইবার দেখতে পাবো। এই মাসেলস এর ভেতরে আমরা নার্ভ ফাইবার দেখতে পাবো, বাইরে থেকে আসবে। এরকম নার্ভ ফাইবার দেখব, ঠিক আছে। নাও the muscle that you are finding over here in a vessel, vessel মানে artery vein, they belong to which system? They belong to the blood vascular system or cardiovascular system. Vessels belong to a system. Arteries আছে, veins আছে, heart আছে, ঠিক আছে, large arteries আছে, smaller arteries আছে, অনেক কিছু আছে। তো এই গোটা জিনিসটাকে আমরা কি বলি? Cardiovascular system or blood vascular system, because through the vessels the thing that is being flowing is nothing but blood, which is a specialized connective tissue, fluid in nature, that you also know. Now, innervating or supplying the muscles are the nerves. তাহলে 4th element এসে গেল। তাহলে দেখো, in the construction of a simple thing such as an artery or a vein, we are finding the assembly of 4 basic tissues. Without the assembly of this basic tissues, an organ or a structure will fail to function. এই কথাটা মাথায় রাখতে হবে, বুঝেছো? সেই জন্যই আমরা এই 4টে টিস্যুকে বেসিক টিস্যু বলছি। আচ্ছা, তাহলে একটা ভেসেল সম্বন্ধে একটা আইডিয়া তোমার একটা হলো। এবার এই মাসেলস গুলোর নেচার বলো তো কিরকম মাসেলস এরা? দিস আর ইনভলান্টারি মাসেলস, ঠিক আছে, উই ক্যানট কন্ট্রোল দেম, ঠিক আছে, বাট ইন অ্যানাটমি উই কল দেম, ফিজিওলজিস্টরা দে উইল কল দেম অ্যাজ ইনভলান্টারি মাসেলস। They are under the influence of a segment of nervous system which is being called as autonomic nervous system. তাই তো, the nerves that are innervating the muscles, they belong to the autonomic nervous system, not to the somatic nervous system. তাহলে এই nerves গুলো nerves, they are very much nerves, ঠিক আছে, but they belong to the autonomic nervous system over which we do not have any control, ঠিক আছে। কন্ট্রোল ইজ ইন্ট্রিনসিক। আমাকে বাঁচিয়ে রাখবার জন্য যেরকম কন্ট্রোল করার দরকার সেরকম কন্ট্রোল করছে। দ্যাট ইজ ওয়াই ব্লাড ইজ ফ্লোয়িং থ্রু দ্য ভেসেলস, ব্লাড ইজ পারফিউজিং দ্য টিস্যুস, তাই না? আচ্ছা, এবার এই মাসেলস গুলো কি? আমি বললাম যে ফিজিওলজিস্ট উইল কল দেম অ্যাজ ইনভলান্টারি মাসেলস। ইন অ্যানাটমি উই কল দেম অ্যাজ আনস্ট্রাইটেড or non-striated or smooth muscles, ঠিক আছে। সব থেকে সহজ নাম যেটা, সেটা তুমি মনে রাখো, they are being called as smooth muscles. তাহলে টিউনিকা মিডিয়াতে তুমি কি দেখতে পাচ্ছ? You are finding in this tunica media smooth muscles. আচ্ছা, these smooth muscles we Indians are not very concerned usually. We the Indians, most of the Indians, আমরা এই স্মুথ মাসেলস নিয়ে খুব একটা বেশি চিন্তা করি না। আচ্ছা, আমরা কি আমাদের ভেতরে আমরা অনেকেই আছি, অনেকে আছে হয়তো ভেজ, বাট সো মেনি পিপল আর দেয়ার হু আর নন ভেজ, ফ্রেশ ইটার্স, তাই তো? আমরা তো ফ্রেশ খাই, আমি খাই, বাকি অনেকে যারা ভেজ আছে তারা নাই খেতে পারে, ঠিক আছে? তো আমরা ফ্রেশ ইটার্স। তো উই ইউজ টু বাই হুইচ টাইপ অফ ফ্রেশ, ইউ টেল মি, ফ্রম ইউর ডে টু ডে লাইফ you can learn anatomy. What type of flesh we used to buy? বলো। skeletal muscles, voluntary muscles, bulky, having plenty of protein, ঠিক আছে? আমরা সেইগুলো কিনি। আমরা এই যে ব্লাড ভেসেলের ভেতরে যে মাসেল আছে, ইন্টেস্টিনের ভেতরে যে মাসেল আছে, সেগুলো কি খাই? খাই না, উই ডোন্ট। কিন্তু আমাদের ভেতরে কেউ কেউ খায়। কারা খায় বলো তো দেখি? Among us humans, which group of people used to eat the intestinal smooth muscle, not the smooth muscle in the vessel wall? বুঝেছো? ভেসেল ওয়াল থেকে স্মুথ মাসেল এক্সট্রাক্ট করাটা কঠিন, বাট ফ্রম দ্য ইন্টেস্টিনাল ওয়াল স্মুথ মাসেলস বের করে নেওয়া যায়। Which group of people used to? Poor people. They don't have enough money to buy the flesh. স্কেলেটাল মাসেলস এর ফ্লেশ কিনতে পারবে না, বুঝেছো? এই যে তুমি দেখছো মাটন অমুক তমুক, হ্যাঁ, আমরা তো গেলাম 800 টাকা দিয়ে কিনে নিয়ে চলে এলাম, ওরা পারে না, ওরা ইন্টেস্টিন গুলো নেয়, বুঝেছো? নিয়ে দে ব্রিং আউট দ্য স্মুথ মাসেলস, তারপরে সেই স্মুথ মাসেলটাকে বাংলায় বলে, ইন বেঙ্গলি উই ইউজ টু কল দেম অ্যাজ ছালুম, বুঝেছো? পেঁয়াজ রসুন লঙ্কা দিয়ে ওটাকে করে মাখা মাখা করে গ্রেভি করলো, ঠিক গ্রেভি করে খেয়ে নেয়, অবভিয়াসলি উইথ বাংলা কান্ট্রি লিকার, বুঝেছো? তো এটা ওদের হ্যাবিট। এবার আমি তোমাকে বলি, সব থেকে বেশি ফ্লেশ ইটার্স কারা? আমরা খুব বেশি খাই না, আমাদের অত পয়সাও নেই, বেশি খাইও না। ফ্লেশ ইটার্স কারা বলো তো? ওয়েস্টার্ন পিপল, ঠিক আছে? ওয়েস্টার্ন পিপল, ইউরোপ, আমেরিকা, অস্ট্রেলিয়া, প্রচুর মাংস খায় ওরা। দে ইউজ টু ইট বোথ দ্য স্কেলেটাল মাসেলস as well as the smooth muscles in the intestinal wall. কারণ ইন্টেস্টিনটা তো অনেক বড়, plenty of muscles can be extracted. In which form they used to eat smooth muscles? ওরা সারা দিন ধরেই মাংস খায়, বুঝেছো? ওরা কার্বস খায় না, কার্বোহাইড্রেট খায় না খুব একটা, সারা দিন ধরেই মাংস খায়। আজকে ইন্ডাস্ট্রিয়াল রিভলিউশন কতদিন আগে হয়েছে? 400-500 বছর, 400-500 years back ইন্ডাস্ট্রিয়াল রিভলিউশন কোথায় হয়েছে? ইন দ্য ওয়েস্ট। তাহলে দে হ্যাভ ডেভেলপড মেশিনারিজ, দে হ্যাভ ডেভেলপড দ্য আর্ট অফ এক্সট্রাক্টিং দ্য স্মুথ মাসেলস ফ্রম দ্য ইন্টেস্টিনাল ওয়াল অ্যান্ড প্রিপেয়ারিং থিংস, delicious things from that smooth muscle. That smooth muscle thing you will find in the continental dish, in the posh restaurants of the great cities, in the 5-star hotels, in the form of sausages. সসেজে কোনো স্কেলেটাল মাসেল থাকে না, বুঝেছো? ইন্টেস্টিনের স্মুথ মাসেল থাকে। সসেজ পক দিয়ে হতে পারে, সসেজ অনেক কিছু দিয়ে হতে পারে, আমি আর অন্যগুলোর নাম বলছি না, কোনো কিছুর নামই বলা উচিত না, কিন্তু দেখো সায়েন্স, আমি বললে কোনো ক্ষতি নেই, ঠিক আছে? সসেজ বিফ থেকে হতে পারে, সসেজ পক থেকে হতে পারে, সসেজ চিকেন থেকেও হতে পারে। ইন্টেস্টিনাল স্মুথ মাসেলটাকে এক্সট্রাক্ট করে নিয়ে ওই প্রিপেয়ার করে, তাহলে ওরা স্মুথ মাসেলও খায়। সর্বভুক, বুঝেছো? omnivores, everything they eat, মাসেল পেলেই হলো, বুঝেছো? খাবে, আর প্রোটিন নেবে, বিরাট বিরাট চেহারা করবে, বুঝেছো? ডমিনেট করবে ওভার আদার্স, যেটা ওরা করে এসছে ফর দ্য লাস্ট 500 to 600 years। ডমিনেট করতে গেলে পেন ইজ মাইটার দ্যান সোর্ড, ওরা ফালতু কথা, বুঝলে? পেন ইজ মাইটার দ্যান সোর্ড সব আমরা যারা এডুকেটেড পিপল আমরা বলি, বড় বড় পোস্টে আছি, আরে আলটিমেটলি হু রুলস? আলটিমেটলি মোদি রুলস, দিদি রুলস, উইথ দ্য হেল্প অফ কার জোরে ওরা রুল করে? উইথ দ্য হেল্প অফ পুলিশ, উইথ দ্য হেল্প অফ আর্মি, অ্যান্ড অল অফ দেম হেভিলি বেল্ট, উইপন্স আছে। পেন ইজ মাইটার দ্যান সোর্ড, আমি বলো এই তুমি এসছো, আমি পেন, বুঝেছো? ওসব বাজে কথা, বুঝলে তো? ওসব আমাদের মন ভোলানো কথা। রুলার্স ওরাই অ্যাকচুয়ালি ফ্রেম করে এইসব কথা, বুঝেছো? পেন ইজ মাইটার দ্যান সোর্ড ও ভুক্ত। যাই হোক, পেন অনেক কিছু দেয়, আমরা এডুকেটেড লোক, আমরা অনেক কিছু পেতে পারি, কিন্তু শক্তি আমাদের নেই, পাওয়ার আলটিমেটলি আমাদের নেই। উই ক্যানট ডিকটেট এনিথিং। ডিকটেট যে করবে তার কিন্তু ঘটনাটা হচ্ছে মাইট দরকার, ফিজিক্যাল মাইট। আর আজকের দিনে ফিজিক্যাল মাইট মানে তো কুস্তি নয়, আজকের দিনে ফিজিক্যাল গান পাউডারের পর থেকে বন্দুক, কালাশনিকভ, বুঝেছো? তাহলে স্মুথ মাসেল টিস্যু, টিউনিকা মিডিয়া, স্মুথ মাসেলস। নাও ওয়াই দিস আর বিং কল্ড অ্যাজ স্মুথ মাসেলস, ইউ টেল মি। অ্যানাটমিতে আমরা এদের বলছি স্মুথ মাসেলস, ওয়াই? হ্যাঁ, দে ডোন্ট হ্যাভ এনি স্ট্রাইশনস, স্ট্রাইশনস নেই। তুমি যদি স্ট্রাইটেড মাসেল দেখো, skeletal muscles are also being called as striated muscles. We find in the microstructure of a skeletal muscle regular striations, but such striations are missing in the smooth muscle. That is why we call them as non-striated, unstriated or smooth muscles. ঠিক আছে? But they have got the ability of contraction, and contraction of the smooth muscles is very important in the organ systems. Without such contractions in the GI tract, food will not be delivered from the stomach to the intestine, from the small gut to the large gut. Peristaltic movement ছাড়া কি করে যাবে? So everything will be dealt with by the physiology people in a nice way, বুঝেছো? কিন্তু স্ট্রাকচারটা আমাদের কাছ থেকেই শিখতে হবে। They will not go into details of the structure of smooth muscle. সেটা তোমার হিস্টোলজি ক্লাসে হবে, তুমি দেখতে পাবে, ঠিক আছে? তাহলে আমাদের ফোকাস হচ্ছে assembly of the four basic tissues, how they are being assembled in a simple structure like an artery. Now, in this medial coat, ওখানে কি আছে আমি বললাম? স্মুথ মাসেলস, স্মুথ মাসেল ফাইবার্স। Depending upon the caliber of the vessel, the thickness of the medial coat will vary. Depending upon the caliber, ধরো একটা বড় আর্টারি আছে, সেখানে medial coat will be much thick than in a smaller calibered artery. Now, in this medial coat, in the larger arteries, you may find an additional element, not muscles. You will find in the larger arteries elastic fibers, not collagen fibers that you are finding here in the adventitial coat, not collagen but elastic fibers in the medial coat. এই medial coat এর ভেতরে alternate layers of muscle, elastic fibers, muscle, elastic fibers, বুঝেছো? Now these elastic fibers you will find in the large conducting vessels, in the large conducting arteries. বড় যে conducting arteries আছে, যাদের principal function is to deliver immediately the blood into the next segment, into the distal segment. Blood এলো during systole in the larger artery, its duty within fraction of a second, its duty is to deliver that blood to the distal part. তার কারণ after every কতক্ষণ পরে পরে একটা হার্টবিট হয় বলো? হ্যাঁ বলো, পয়েন্ট, হ্যাঁ ভেরি গুড, 0.8 সেকেন্ড। বা এরা তো বেশ ভালো ফিজিওলজি পড়ে ফেলেছে অলরেডি। তাহলে একটা হার্টবিটের ডিউরেশন হচ্ছে 0.8 সেকেন্ড। তাহলে আফটার 0.8 সেকেন্ড এগেন a systole will be coming, again the blood will be coming. Therefore that vessel has to empty itself, otherwise how can it accommodate the blood in the succeeding systole? Therefore nature has provided elastic fibers, বুঝেছো? এই চাপলো, বেরিয়ে গেল, আবার খুলে গেল, so that in the next systole, in the succeeding systole, blood can be accommodated in that artery. তো এইরকম আর্টারিকে আমরা বলি কন্ডাক্টিং আর্টারিজ। In the wall of the conductance vessels বলে, conductance arteries or conducting arteries, you will find elastic lamellae, alternate elastic lamellae with the muscle lamella. ল্যামেলা মানে একটা লেয়ার হিসেবে থাকে ইলাস্টিক ফাইবার্স। তাহলে এইরকম আর্টারিকে আমরা কি বলি বলতো? এইরকম আর্টারিকে বলি ইলাস্টিক আর্টারিজ। এইগুলো হচ্ছে জেনারেল আর্টারি। এইগুলো তোমার এমসিকিউ কোশ্চেনে থাকতে পারে, মাল্টিপল অপশনস থাকবে। আমি বলে দিচ্ছি এক্ষুনি এক্সাম্পল, ক্লাসিক্যাল এক্সাম্পল বলছি। ইন এমসিকিউ কোশ্চেন্স ইউ ক্যান ফাইন্ড questions from general anatomy. In the viva table, examiner may ask you. বুঝেছো? These are simple things that one has to know while preparing for the university exam. ফাইনাল এক্সামের জন্য যখন তুমি তৈরি হবে তোমাকে জানতে হবে। আচ্ছা, this is a vessel, very important vessel. Aorta. Aorta, you all know. This is the vessel that is connected to the left ventricle of the heart. ঠিক আছে? This vessel is responsible in delivering all the blood into the systemic circulation. ঠিক আছে? পুরো যে 1 মিনিটে 5 লিটার of blood, ঠিক আছে? It will be called into action during every systole, each systole, and in a minute it has to deliver that 5 liter of blood into the systemic circulation. তাহলে এই যে aorta, it is a classical example of an elastic artery. এইবার তোমার এমসিকিউ চলে আসবে, ইলাস্টিক আর্টারি, সেখানে ধরো এওটাটার নাম থাকবে, তোমার এটাতেই অপশনে টিক মারতে হবে, এছাড়া আদার আর্টারিজ দিয়ে দেবে, ইউ হ্যাভ টু রুল আউট দোজ আর্টারিজ। তাহলে ক্লাসিক্যাল এক্সাম্পল অফ অ্যান ইলাস্টিক আর্টারি ইজ দ্য এওটা, অ্যান্ড দ্য লার্জার ব্রাঞ্চেস ফ্রম দ্য এওটা আর অলসো ইলাস্টিক আর্টারিজ। বুঝেছো? লার্জ ব্রাঞ্চেস আছে ফ্রম দ্য এওটা, তো সেই লার্জ ব্রাঞ্চেস গুলো আর অলসো ইলাস্টিক আর্টারি। সেটা তোমার যখন হবে এওটা তুমি সব জানতে পারবে, এখন আমি বলছি না কিছু। আচ্ছা, নেক্সট, তাহলে ইন দ্য ইলাস্টিক আর্টারিজ ইউ আর ফাইন্ডিং ইলাস্টিক ল্যামেলা, অল্টারনেটিং ইলাস্টিক ল্যামেলি in the medial coat. Medial coat is mainly, it is so called because it is packed with muscles, but in the elastic arteries you are finding alternate elastic lamellae in the medial coat, interspersed between the muscle lamella. Muscle fibers দিয়ে যে একটা লেয়ার আছে, তারপরে ইলাস্টিক ফাইবার্স দিয়ে একটা, আবার মাসল লেয়ার, এইভাবে থাকবে পরপর ইন সিকোয়েন্স। তো এইবার আর একটা গ্রুপ অফ আর্টারিজ আছে, তাকে আমরা বলি মাসকুলার আর্টারিজ। মাসকুলার আর্টারিজ, মাসকুলার আর্টারিজ বলে একটা গ্রুপ আছে। In the muscular arteries, all these coats will be there. Tunica adventitia, adventitial coat, the medial coat, the endothelial coat, all the coats will be there. But the muscles in the medial coat play their role most in the muscular arteries. Muscles in the medial coat, muscles in the medial coat play their role in every vessels, no doubt about that. But in this group of vessels, muscles play their role most, ঠিক আছে, in the muscular arteries. Now classical examples of muscular arteries are, classical examples of muscular arteries are the coronary arteries, very important group of arteries, coronary arteries, coronary arteries, classical example. এছাড়া all the distributing vessels, all the distributing arteries are classified under the group of muscular arteries. তাহলে there are some arteries which will simply conduct the blood, ডিউটি হচ্ছে শুধু আমি ব্লাডটাকে ঠেলে দেব, and there will be other group of arteries which will be distributing that blood, which has the function of distributing the received blood into the organ systems, into the tissues. They are being called as the distributing arteries. The distributing arteries are classed under the heading of muscular arteries. ঠিক আছে? Now another group will be there. এই যে আমাদের কার্ডিওভাস্কুলার সিস্টেম আর ব্লাড ভাস্কুলার সিস্টেম, এতে আমরা আর্টারিজ নিয়ে কথা বলছি, তাই তো, বাট ভেন্স আর দেয়ার, ভেরি ইম্পর্টেন্ট গ্রুপ অফ ভেসেলস। They will return the blood, deoxygenated blood, into the heart. The blood that is being received via the arterial system will be utilized, important elements from that blood will be utilized by the tissues, and the impurities from within the tissues will be delivered into the venous system, which will be carried to the heart. The veins are also a group of very important vessels, but we have not yet discussed anything about the veins. In the veins, you will find all these three layers, but especially the medial coat, and the adventitial coat will be relatively thinner in veins. As you dissect the human body, you will find the arteries as thick-walled, ঠিক আছে, the veins as thin-walled, বুঝেছো? Unless the veins are having clots, you will find the veins as collapsed vessels হিসেবে পাবে, unless they are having clots within them. But in the arteries, you will never find any clots, and they will appear thick, and even look of the vessels will differ. The very look, তুমি তো naked eye examination করছো, তুমি দেখেই বুঝতে পারবে কোনটা vein, কোনটা artery, ঠিক আছে? Larger arteries will be dull red in color, dull red. Even in cadaver, you will find dull whitish red, বুঝেছো? এইরকম মতো একটা কালার তুমি দেখতে পাবে আর্টারি, লার্জার আর্টারিজ, দেখলেই চিনতে পারবে। তারপরে ফিল করতে হয়, ফিল করলে দেখবে you can pretty well ascertain or appreciate that this is a thick-walled vessel. But by the side of an artery, you will always find, and always, most of the time, you will find beside a larger artery, you will find a large vein. But that vein is thin-walled. If blood clots are not there, it will be a collapsed vessel, plus it will be appearing bluish black, বুঝেছো? কাজে আর্টারি ভেন চিনতে কিচ্ছু অসুবিধা হবে না। তাহলে veins are having all these three coats: tunica adventitia, tunica media, tunica intima. But the medial coat and the adventitial coat will be much thinner in the veins. Now let me tell you the next group of vessels. The next group of vessels are being called as the resistance vessels. The resistance vessels. Can you tell me which group of vessels are called as resistance vessels? তার কারণ তোমরা অনেক কিছু উত্তর দিচ্ছ ভালো। রেজিস্ট্যান্স ভেসেলস তোমাদের অ্যাকচুয়ালি, তোমরা যে কোচিং ক্লাসে পড়ো, অনেকেই তো পড়ো, সেখানে সব বলা হয়, আমি জানি, ডাক্তারি পরীক্ষার জন্য। তা বলো রেজিস্ট্যান্স ভেসেলস মানে কি, কোনগুলো? which capillaries? No, capillaries cannot be resistance vessels. Which group of vessels are principally responsible for maintaining the blood pressure? বুঝেছো? এই যে আমাদের ব্লাড প্রেশারটা একটা নর্মাল প্রেশার মেনটেন হয় 120/80, হ্যাঁ, রেঞ্জ আছে, মানে ফিক্সড কিছু নেই। হ্যাঁ, অনেক উইমেন তুমি দেখতে পাবে, আমাদের রুরাল উইমেন, ব্লাড প্রেশার 60/90, 90/60 or 100/60 এরকম নিয়ে দিব্যি চলছে, কোনো অসুবিধা হয় না, বুঝেছো? হাইপোটেনশন, সেইভাবে দেখতে গেলে হাইপোটেনশন, লো ব্লাড প্রেশার, কিন্তু কোনো অসুবিধা হয় না। পারফিউশন অফ দ্য টিস্যুজ, নর্মাল লাইফ অ্যাক্টিভিটি, কোনো প্রবলেম কিছু হয় না। তো যাই হোক, এবার এই যে ব্লাড প্রেশার, হোয়াট এভার ইট is maintained by this group of vessels. Now tell me which group of vessels? Arterioles, বুঝেছো? Relatively finer branches from the arterial system before the capillaries, আমরা arterioles দেখতে পাই। তাহলে arterioles are the vessels responsible for maintaining blood pressure, ঠিক আছে? কোন ব্লাড প্রেশার? diastolic pressure, বুঝেছো? not the systolic. Systolic pressure depends upon the contractility or contractile ability of the heart muscle. Systolic pressure. Diastolic pressure is maintained mainly by these arterioles offering peripheral resistance to the flow of blood, বুঝেছো? diastolic pressure depends upon peripheral resistance. তুমি এটা ফিজিওলজিস্ট অনেক ভালো করে তোমাকে বলবে, Diastolic pressure depends upon the peripheral resistance. ঠিক আছে? Diastolic pressure depends upon the peripheral resistance. That resistance is offered by the arterioles. তাহলে in the arterioles, the medial coat will be specially thick in proportion to its caliber. Arterioles খুব বেশি বড় হবে না, ফাইনার ভেসেলস আমি বলছি, তো ক্যালিবার ওয়াইজ এর মিডিয়াল কোটটা কিন্তু অনেক বেশি ঠিক হবে, ডিসপ্রপোর্শনেটলি থিক। আমরা ভালো করে ইংরেজিতে বলতে গেলে ডিসপ্রপোর্শনেটলি থিক medial coat will be seen in the arteriolar wall. তাহলে arterioles are being classed as resistance vessels. Arterioles. Arterioles. Next, ও যেটা বললো, he has tried his best to name the resistance vessels, কিন্তু ভুল করেছে, ভুল হতেই পারে মানুষের, ও ক্যাপিলারিজ বলেছে। তাহলে we will group the capillaries under which group of vessels? Tell me. Capillaries are the most important element of the blood vascular system. All the elements are important. Without the conductance vessels, how the blood will be delivered into the capillary system? But ultimately, function-wise, capillaries are the most important group of vessels. ঠিক আছে? Capillaries, how do they present in the human body? In the form of plexus. In the form of plexus, very fine vessels, capillaries. ঠিক আছে? ক্যাপিলারিজ গুলোকে আমরা কিভাবে দেখতে পাবো? In a plexiform manner, we will find them. We will find the capillaries like this. এইভাবেই তো বইয়ে দেখানো থাকে। জাল, নেটওয়ার্ক অফ ভেরি ফাইন ভেসেলস। ঠিক আছে? ইন্টারকমিউনিকেটিং। এই নেটওয়ার্ককে ফিট করবার জন্য এখানে একটা আর্টেরিওল থাকে, আর এখান থেকে একটা ভেন বেরোয়, ভেনিউল। ওপেন এন্ডেড, তো এই সিস্টেমটা তো ক্লোজ নয়, ওপেন এন্ডেড। তাহলে এইখানে একটা ভেনিউল থাকে, এরকম একটা ভেনিউল থাকে, এরকম একটা ভেনিউল থাকে, আর এখানে একটা আর্টেরিওল থাকে। তাহলে এই যে ক্যাপিলারি সিস্টেম, ফাইন ভেসেলস ইন্টারকমিউনিকেটিং। আমার মনে নেই এখানে এইরকম ফ্যাক্টগুলো খুব ভালো, মানে কত কিলোমিটার হবে হিউম্যান বডি। আমি তো বলেছি হিউম্যান ইজ এ মডারেটলি সাইজড ম্যামাল। তো ইভেন ইন দিস মডারেটলি সাইজড ম্যামাল, তুমি যদি এই ক্যাপিলারি ইন্ডিভিজুয়াল ক্যাপিলারিজ গুলোকে তুলে নাও, তুলে নিয়ে পরপর এন্ড টু এন্ড জয়েন করো, তাহলে কত কিলোমিটার হবে সেটাও বলা আছে গ্রের বইতে, বুঝলে? পুরো আর্থ অ্যারাউন্ড দ্য ইকুয়েটার, গ্লোব অফ আর্থ অ্যারাউন্ড দ্য ইকুয়েটার কবার ঘুরতে পারবো এইরকম লেন্থ হয়। আমি ভুলে গেছি, বুঝেছো? গ্রেজ অ্যানাটমি, আমাদের বাইবেল যেটা, তার ভেতরে লেখা আছে, বুঝলে? এই ক্যাপিলারিজ এন্ড টু এন্ড জয়েন করলে কত কিলোমিটার হবে। আফটার অল দিস আর লংগিটিউডিনাল ভেসেলস, ভেরি ফাইন ইন ক্যালিবার। তাহলে এই ক্যাপিলারিজ কে আমি কোন গ্রুপে ফেলবো বলো? এইটা জানতে হবে, সহজ। ক্যাপিলারিজ আর বিং গ্রুপড আন্ডার দ্য হেডিং অফ এক্সচেঞ্জ ভেসেলস। থ্রু দ্য ক্যাপিলারিজ, তুমি কি ওই বড় বড় আর্টারির এরকম থিক ওয়াল এক্সচেঞ্জ হবে? অক্সিজেন অ্যান্ড নিউট্রিয়েন্টস, how do they can flow into the tissues through the thick walled vessels? নেচার ভীষণ প্রুডেন্ট, সেই জন্য ও সব রকম ভেসেলকে রেখেছে। যে গ্রুপ অফ ভেসেলস কন্ডাক্ট করছে, ওয়াল তো ঠিক, ওখান দিয়ে যাবে কি করে রে ভাই অক্সিজেন? তাহলে ভেরি ফাইন ভেসেলস ইন দ্য ফর্ম অফ এ নেট উইল পারফিউজ দ্য টিস্যুস। বুঝেছো? যে টিস্যু দিয়ে অর্গান তৈরি, যে টিস্যু দিয়ে এভরিথিং তৈরি। তাহলে পারফিউশন অফ দ্য টিস্যুস ইজ বিং মেনটেইনড বাই দ্য ক্যাপিলারি সিস্টেম। Therefore, capillaries are being called as the exchange vessels. তাহলে এক্সচেঞ্জ ভেসেলস এই নামটা তোমাকে অবশ্যই মনে রাখতে হবে। এক্সচেঞ্জ ভেসেলস তোমাকে জিজ্ঞেস করবে এবার তুমি প্রশ্ন করতে পারো যে স্যার আমি কি এই আর্টেরিওলস আর এই ক্যাপিলারি সিস্টেম আমি খুঁজবো? মোটেই না। তোমাকে ডাইসেকশনে তুমি মোটেই খুঁজে পাবে না ক্যাপিলারিজ, বুঝেছো? এসব স্পেশালি প্রিপেয়ার্ড, আস্তে আস্তে ধীরে ধীরে রিসার্চ ওয়ার্ক যারা করে তারা এগুলো বের করে। এগুলো তোমাকে সব ভিজুয়ালাইজ করতে হবে, ঠিক আছে? যখনই তুমি একটা অর্গান বা একটা টিস্যু প্রপারে ঢুকে যাচ্ছ, মেন ভেসেল তো আর থাকবে না, সেখানে দ্য মেন ভেসেল উইল বি রিপ্লেসড বাই দ্য ক্যাপিলারিজ which are responsible for providing nutrition and oxygen to the tissues and are also responsible for extracting carbon dioxide and impurities from the tissues, this capillary system. বুঝেছো? আচ্ছা, তাহলে হয়ে গেল এক্সচেঞ্জ ভেসেলস। আর সময় আমার নেই, আমাকে ছেড়ে দিতে হবে। তুমি কিন্তু দেখো ওই কমিউনিটি মেডিসিনের স্যার এসছে কিনা, ওর সঙ্গে আমার কথা হয়েছে ব্রেকফাস্ট টেবিলে। আচ্ছা, নেক্সট ভেন্স। আচ্ছা, ভেন্সকে আমরা কি কোনো লার্জার ভেন্স, এই লার্জার ভেন্স গুলোকে আমরা কোনো গ্রুপে কি ফেলতে পারি? লার্জার ভেন্স, ধরো লার্জার ভেন্স বলতে নাম বলো তো দেখি একটা দুটো। হ্যাঁ, ভেনা কেভা, একটা সুপিরিয়ার আছে একটা ইনফিরিয়ার আছে। এবার ভেনা কেভার পরে সুপিরিয়ার ভেনা কেভা is formed by the union of a pair of brachiocephalic veins, বুঝেছো? একটা রাইট থেকে আসবে এরকম, আর একটা লেফট থেকে আসবে, এসে সুপিরিয়ার ভেনা কেভা তৈরি করবে। ইনফিরিয়ার ভেনা কেভা সিমিলারলি উইল হ্যাভ সো মেনি ট্রিবিউটারিজ, অনেক ট্রিবিউটারিজ থাকবে, কিন্তু দ্য প্রিন্সিপাল ফর্মেটিভ ট্রিবিউটারিজ অফ ইনফিরিয়ার ভেনা কেভা আর দ্য কমন ইলিয়াক ভেন্স। তো এই কমন ইলিয়াক ভেন, এক্সটার্নাল ইলিয়াক ভেন, ইন্টারনাল ইলিয়াক ভেন, ইনফিরিয়ার ভেনা কেভা, সুপিরিয়ার ভেনা কেভা, ব্রেকিওসেফালিক ভেন্স, বুঝেছো? জুগুলার ভেন্স, এই যে ভেন্সগুলো, এই ভেন্সগুলোকে আমরা একটা গ্রুপে রাখি। সেই গ্রুপটাকে কি বলা হয়? ক্যাপাসিট্যান্স ভেসেলস। দ্যাট মিনস দিস ভেসেলস হ্যাভ গট দ্য ক্যাপাসিটি টু স্টোর ব্লাড ফর সাম টাইম, বুঝেছো? সেই জন্য এদেরকে আমরা বলি ক্যাপাসিট্যান্স ভেসেলস। তোমাকে জিজ্ঞেস করতে পারে পরীক্ষায় অথবা এমসিকিউতে আসতে পারে, আমি কতগুলো আর্টারির নাম বলবো, তারপরে একটা ভেনের নাম বলবো, আসেনি, তাদের আমরা বলবো ক্যাপাসিট্যান্স ভেসেলস। স্যার আসতে পারবে না, তার কারণ স্যারের পরপর দুটো ক্লাস আছে। স্যার সেকেন্ড ইয়ারের ক্লাস নিচ্ছে 9টা থেকে 10টা, তারপরে আবার এইটাই আসবে, কিন্তু তাও আমার দেখাটা দরকার। ক্যাপাসিট্যান্স ভেসেলস, ঠিক আছে? ক্যাপাসিট্যান্স ভেসেলস, দ্যাট মিনস দে হ্যাভ গট দ্য ক্যাপাসিটি টু স্টোর ব্লাড, বুঝেছো? ভেন্সের এই পিকুলিয়ার ক্যাপাসিটিটা আছে টু স্টোর ব্লাড ফর সাম টাইম, কিন্তু এতে ভালো আছে যেমন মন্দও আছে, মন্দটাই বেশি, বুঝেছো? হ্যাঁ, বুঝলে? ডিপ ভেন্সে ব্লাড জমে আছে অনেকক্ষণ, ঘন্টার পর ঘন্টা, ফর আওয়ার্স। ডিপ ভেন্স, কিছু ডিপ ভেন্স আছে, প্রেফার্ড সাইটস আছে, বুঝেছো? কিছু ডিপ ভেন্স আছে যেখানে এরকম ভাবে ব্লাড জমে থাকতে পারে। জমে থাকলে আলটিমেটলি দেয়ার উইল বি ফর্মেশন অফ থ্রম্বাস। হ্যাঁ, ডিপ ভেন থ্রম্বোসিস, তাকে আমরা ক্লিনিক্যালি বলি ফ্লেবোথ্রম্বোসিস। ফ্লেবোথ্রম্বোসিস, তাহলে এরকম ফ্লেবোথ্রম্বোসিস হলে when that thrombus gets dislodged in the circulatory system, থ্রম্বাসটা ছুড়ে দিল, বুঝেছো? এবার ভেন থেকে কোথায় যাবে? আর্টারি। এবার আর্টারি, সরি, ভেন থেকে কোথায় যাবে? হার্ট। এবার হার্ট মানে রাইট হার্ট। ভেন্স ultimately deliver the deoxygenated blood into the right side of the heart, right atrium, from the right atrium to right ventricle, right ventricle থেকে pulmonary trunk, pulmonary arteries, pulmonary embolism হবে, বাস, ইনস্ট্যান্ট ডেথ। তুমি যদি ডায়াগনোসিস না করতে পারো, লার্জ পালমোনারি আর্টারিতে যদি একটা থ্রম্বাস গিয়ে লজ করে, ডেথ, বুঝেছো? কাজেই ভেনে রক্ত জমছে কিনা এটা কিন্তু ভীষণ মাথায় রাখতে হবে। তাহলে কাদের রক্ত জমবে বলো তো, জমে থাকবে? যারা বেড রিডেন। সেই জন্য বেড রিডেন যারা, তাদের কিন্তু সবসময় ম্যাসাজ করতে হয় লোয়ার লিমস, বুঝেছো? লোয়ার লিমসে সবসময় ম্যাসাজ করতে হয়, আর আপার লিমটা মাঝে মাঝে এরকম তুলে দিতে হবে, বুঝেছো? তাহলে রক্ত জমবে না। লোয়ার লিমস থেকে তুমি তো বুঝতেই পারছো এগেনস্ট গ্র্যাভিটি রক্তটা উঠছে, কাজে লোয়ার লিমসে কিন্তু ব্লাড টেন্ডস টু কালেক্ট। in the veins of the lower limb. এবার স্পেশালি কোন ভেন্স আমরা যখন লোয়ার লিম্ব বলবো তখন পড়াবো সব। এবার তুমি ডিউরিং ইউর ডিসেকশন তুমি কিন্তু বুঝতে পারবে যে ভেন্স আর ক্যাপাসিটেন্স ভেসেলস। এই যে আগেই বলেছি, তুমি ভেন্সে কি পাবে? ক্লট। কোনো আর্টারির ভেতরে ক্লটস দেখতে পাবে না, আর্টারি সব এমটি, কোনো রক্ত ক্লট ফ্লট কিছু নেই, বুঝেছো? নেচার এইরকমই, লাস্ট ধুকপুক ধুকপুক লাভডুপ 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 এরকম হচ্ছে তো। লাস্ট যে হার্টটা বিট করলো সব রক্ত আর্টেরিয়াল সিস্টেম দিয়ে টিস্যু, টিস্যু হয়ে ভেন্স, তুমি তো মরে গেলে, সব রক্ত চলে আসবে ভেন্সে, হয়ে গেছে আবার, বুঝেছো? সেই জন্য ভেন্সকে বলা হয় ক্যাপাসিটেন্স ভেসেল, এবং তুমি যখন ক্যাডেভার ডিসেকশন করবে তুমি দেখতে পাবে।
One thing I can tell you for non-Bengali students, because you are pursuing medical science, okay? So you will come across with the public. So you learn Bengali, and it is not very difficult because it is not a sweet language we used to say, not difficult, because if you come across your fellow patients or patient parties, you have to communicate in local language, okay? So learn Bengali as much as possible, and sometimes we teachers also sometimes go to our Bengali vernacular or like that. Okay, so let me introduce, my name is here, I am Dr. R.N. Chaudhary, Professor and Head of the Department of Community Medicine. Now, considering that community medicine is very new to you, because all of you from your experience, initially when we were students, I am from Calcutta Medical College, so at that time not that much of students were there. So we usually in our first class we used to say, introduce myself and introduce to all of you. What is your name? From where you are all listening? Nowadays so many students are there, so it will take 1 hour or more. So we don't go in that way. Subsequently you will stay in this college for 5 years or more, and other things we will be, introduced to each other in our future days, nothing to worry. So community medicine, actually when we were students, community medicine used to be taught in 1 year only, 1 year or 10 months, and after that exam used to held. But after that community medicine has been developed in all branches of medical science, has been developed, no doubt of it. It is going by days, as in anatomy, physiology, biochemistry, medicine, surgery, gynae, what not, and it will increase more in future also, because so many factors are there. You will understand all those things. So community medicine has developed a lot. In our days, it was used to call preclinical, just like anatomy, physiology, biochemistry. But now it is a clinical medicine. Community medicine is called a clinical medicine. Though the notion in the going on is it is a preclinical subject or like that. Some call paraclinical, preclinical. So what previously Medical Council of India, now you must acquire all those, acquainted with these nomenclatures, now called National Medical Commission. After when this BJP government came, Modi government, they make it National Medical Commission. So as per Medical Council of India or National Medical Commission, they call it, for making it, all those things, they making it clinical medicine, and they are telling that the exam will be held during clinical time. So our exam will be held at the end of 3 years, your 7th semester. Okay, that means so much of subject developed, so much of importance have been given. So during first year, second year, third year, it will be classes and all those things. But actually, frankly speaking, in the society, in the, I should say, socio-political domain, in the society, yes, nowadays people are, students are coming and doing postgraduates in MD. It is not that much of, what should I say, not that much of popular, even in the practical field. But after post-graduation of this subject in community medicine, you will get better jobs than other disciplines. You will get better jobs in WHO, World Health Organization, UNICEF, international organizations, so many. And in most of these states in our country, in West Bengal it is a bit more, in other states also there, but not much. in the healthcare delivery system, the administrative positions, suppose the chief medical officer of Birbhum or deputy chief medical officers are called. These should be as it is called from the field of community medicine. Okay, West Bengal a bit better. Most of these, suppose here the CMO chief also, he was actually he was my student. Actually, I passed so much about my teaching life, and I don't know whether you will know or not. You will be knowing in All India Institute of Hygiene and Public Health. That is near Calcutta Medical College at the crossing of Kolutora Street and Central Avenue. It is 100% central government institute, first postgraduate institute in Asia. Just like, which is the first medical college in Asia? Calcutta Medical College. So, we always used to proud of it. So many, Dr. Bhattacharya Sapanda also from Calcutta Medical College. So many are from Calcutta Medical College. And the first public health institute in Asia is All India Institute of Hygiene and Public Health in Kolkata. But people do not know that much, because I have already told you, when you become doctor, anybody may ask you, oh, you are a doctor, where is your chamber? Doctor mane you have to do practice on patients. Suppose the head of the department anatomy does not do any practice. I also don't do any practice, but we were teachers, we serving some people. So just like that, if you do community medicine, you will get plenty of jobs in the government sector and in private sector. I mean, with a very good salary, and you have to travel. I got an offer in WHO, but I did not go due to some family problems, etc., etc. All those things. At those times, it was much salary higher. But you have to visit so many travels up there. You have to go foreign countries. The headquarter of WHO is in Geneva. Okay, and always remember, some of the terms in community medicine is very important. So it is World Health Organizations. Don't say who. Don't say who. If you say who, some of the examiners are that you make them zero. So always say WHO. Okay. So these are the terms, always remember. Don't say who. You will see in the TV and all the things talks, some layman or some people know. In Bengali it is called Vishwa Swasthya Samstha, and because the whole world, all the countries are members of WHO, World Health Organization. See, you see this recent corona and all those things. All countries follow the guidelines and strategies of WHO. Okay, because all these things are there. So all these things you can get the job. So in future, I'm not telling you. Another thing is for community medicine, you may not attend classes. You will understand from your seniors. People are not attending that much of classes. But in postgraduate and other courses, questions from community medicine are much more than in other subjects. Why? All these things you will understand, all these things. Okay, so whether you attend class or not, and I always used to say, I don't know whether other teachers used to say, yeah, we live in a democratic country. It is your democratic right. I will not do class. We will not take any punitive action. I am not taking you. From our government side, from our department side, we will not take any punitive action. It is your duty if you attend class. But if you attend class, suppose 5 or 10 are attending class, don't disturb them. Okay, and one thing. And another thing, it is always better, not in a class also, always to make your mobile silent. You may call, but I used to call, it is an idiotic machine actually. Yes, it is very essential and all those things, but it causes sometimes very nuisance. Okay, it causes distraction. So you may have some emergency calls or like that, make in a silent mode so that your friend does not get distracted. Okay, this is one thing. Second point, I used to say not our disciplines, for other disciplines also, always remember, it is a, though it is a graduation, you know, all these things, medical science is another type of it. We don't know, I may be a teacher, I may be a faculty, that does not mean I know everything, always remember. So, when someone is discussing in the class, if you don't, understand or did not listen, or afterwards you want to discuss, always ask questions. Nothing wrong. Don't think that if I ask questions, what my fellow friend will think. When you go to the brave, up to that you have learned. Okay, because learning has no limit. We do not know everything. It is not possible to know everything. So always learn, and through interactions on all those things. And nowadays it is called teaching. Not only colleges, in the schools also, teaching is called, teacher is a facilitator. We will facilitate you. You have to learn yourself. You have to learn yourself. We will facilitate you. We will guide you how to learn. Okay. So you have to learn, and all things, and I have already told you that all the subjects in medical science, plenty of disciplines. Though it is a community medicine, it is a discipline, but it has got several subjects, several disciplines. Epidemiology, biostatistics, maternal and child health, occupational health, so many, environmental science, etc., sociological science, etc., etc. So plenty of science is there. So all things may not be discussed, and you cannot say, sir, this was not discussed in the class, why it came in the examinations. You cannot say like that. Okay. So this is another thing. So we will be introduced to us. Our department is in the block 1. In the principal's office, you have seen student principal office. The first floor, whole first floor is community medicine. It is as it is a private institution, so not that much of staffs are there. Sometimes it remains open. You can visit. It is very nicely displayed. We have a museum. Plenty of models are there. Specimens are there. The corridors are full of charts and graphs, etc., etc. Posters, rooms are there. Everything. The whole first floor of block 1 is a department of community medicine. Okay. So coming to the community medicine, actually, community. What is community? Community is, what is community? Right, a group of people. You can say this is a MBBS community. You can say this is a MBBS community, MBBS students community of 2023 batch. Okay. I can say the whole MBBS students, first year, second year, third year, is also a community. I can say that Muluk, this village is called Muluk, Govindapur Muluk. So Muluk is a community. I can say the Bolpur is a community. I can say Birbhum is a community. West Bengal is a community. In the community also, you can say there is a group of people living together, or other, or maybe there may be religion-wise Hindu community, there may be Muslim community, there may be a Christian community. So community is a group of, we will discuss all those things. It is a group of all these things. So community medicine means in individual, suppose as I have already told you, oh, are you a doctor? Do you have a chamber? That means the clinical medicine people, the clinical medicine, I am not disrespecting anyone. Their main individual responsibility. They treat you, manage you, only you, single wise. But community medicine people, or the subject of community medicine, sees the whole community. So if you say a medicine specialist may say, my patient is, suppose Mr. Abdul or Devashish or Swapna or Meena, or like that. But we say our community, our patients are the community, the village. Okay. So we offer the health services to the whole community. You will understand the most of the developments in the health. As you know, health is throughout the world. Health advances are much more. Even when we were students, we used to say the lifespan of Indian people, average lifespan of Indian people is 55 or 60 years maximum. Or now, what is the present lifespan of India? 70 in average. You are right, 70. And who are living longer, male or female? Females, right. So I always used to ask, who are stronger in this world, male or female? Case stronger. Scientifically I am asking. I am not asking in other way, emotionally. Who are stronger? Male. No, females are stronger. Why? Why females are stronger? For this reason they are living more. The average lifespan of females, as she is saying, average lifespan of female is around 74-75. Average lifespan of men equal to 68 or 69. So average of whole people coming 71-72. Okay, because in this average in statistical average, but women are living more. But women, if you see in the outdoors, in the indoors, women are patients more. That is due to our neglect, society neglect. Because why women are more? Women have sex chromosomes XX. Do you know sex chromosome? And what is male sex chromosome? XY. So X is different, Y is different. The both are not strong enough. Both of you are going, suppose, I am not talking XXY. So who are going Y? So somebody attack you. If both of you males are there, you will be more stronger. Otherwise, if you or your a younger person, or you and a female, your girlfriend is there, you are not that strong. So XXY, it is scientifically your XX are much stronger. So women are living more. Okay. So don't disgrace women. They are much stronger to you. May not be stronger means throughout but probably in most of the developing countries, you see, we are neglecting women. But it is proved. Community medicine also says like that. Community medicine, it is like that. You are seeing that so much of reservations for women, women empowerment. So we say that if woman is empowered, I mean, community medicine says, if woman is empowered in the family, that family will be healthy. Okay, so if you empowered in your physically, I mean health-wise, economically, educationally, in decision making, etc., so you can look after your father, mother, husband, children, etc., and all those things, and other relatives. Okay, and it is proved that don't feel that Indian women are separate that of American women. Women is the pivot of the family. Okay, all this. So if women remain stronger, the family will remain stronger. If families become stronger, the society will be stronger. Okay, so this is about community and all those things. In community medicine, I already told you, clinical medicine, when the medicine developed, at that time community medicine not that much developed. Community medicine has been developed after, say, last so much development is there, 40 to 60 years or 70 years or so, like that. Today the discipline is called community medicine. When I passed my MD degree is MD in PSM, preventive and social medicine. You will get a book, still the name remains in library, which you have to study. So many books are there, very common book, Park's textbook of preventive and social medicine. The name has not changed, but previously this discipline was used to call social medicine, socialized medicine, social and preventive medicine, preventive and social medicine, public health, and then now it is called community medicine. Because it has some developments are there. But in our day-to-day practice, somebody, hey, aajke public health class hoyeche, today public health class, that means they are meaning community medicine. Remember, or anybody in which post-graduation you are studying your post-graduation, public health. That means he or she is pursuing post-graduation in community medicine. Okay, that is locally we use it. But always remember, local and scientific name is separate. Okay, so the department is called community medicine, discipline is called community medicine, university is community medicine. Okay, but you can say it public health. Now, in community medicine, I have already told you that in clinical medicine, they are concerned with the disease. When you are diseased, you go to the doctor. Okay, but community medicine does not say about disease. Community medicine says about health. When in our early days, when we were young, all of you know, and you have seen the so many films, we are very much fan of Amitabh Bachchan. At that time, he was an angry young man. So I used to show the picture of Amitabh Bachchan in PowerPoint and ask the students, is he healthy? Yes, sir, he is very healthy, because he so much of we by one man, making dishum to so many villains and etc. Okay, but he is not healthy because he has some disease, myasthenia gravis and other things also, and it is called, he has some genetically it is not exposed. Some gene is there, but Jayabaduri is not, that gene is not there. You will understand genetic makeup. So thalassemia and all those did not develop. All these things in our offspring. So we say the people should be healthy. we should not say. You may be disease free, but you may not be healthy. Okay. So, we describe the definition of health. Always remember, you are in your exam, you are so many questions are asked. So, the examiner may tell you, I have to make you pass. At least you say one thing, define health. So, define health is very simple. So many definitions are there. You will get in the books. Throughout your life, it must be in your lip. Very easy. Definition of health. So many definitions are there. But remember the first one. This is the ideal definition given by WHO. Very easy. You may not write it, you just remember it. Because throughout your life, you have to remember it. And every word is important. Health is a state. Health is a state. So, state what is important? Complete physical, mental and social well-being, and not merely an absence of disease or infirmity. What is the meaning of infirmity? Google দেখলে পেয়ে যাবে. Not feeling well, ভালো লাগছে না, not like that. So that means if you are healthy, physically you are healthy, no disease and all those things. Physical, no symptoms and etc. Mentally you are healthy, always joyous and all those things. I mean, with friends you are very cool and etc. With seniors, with your parents, etc., relatives, etc. And socially also, with the social husband, you are very much healthy, but not merely the absence of disease, always. So, this definition, don't forget, never, throughout your practicing life. Okay, so it is a state of, it is ideal. So many definitions given by different organizations, different public health associations, etc., etc., etc. But this is the main definitions given by WHO so that people can understand. All people in the community, they can understand the definition. Okay, we'll discuss on all those things. So there are several domains, it is called, in physical subdomain, mental subdomain, social subdomain, etc., etc. These are regarding health. Okay? So not merely the absence of disease or infirmity. Disease means you may not have exact pathological disease. Okay, but you may not feeling that way. I mean, doctor also, না কিছু তো পাচ্ছি না আপনাকে, আপনার তো ভালোই আছে, তাহলে চিন্তা করছেন কেন? But I am not feeling well. I may be feeling etc. a bit of fatigue, a bit of nauseating, etc., etc. like that. But that may be several issues are there. It may have stress and strain, etc., etc. Exam stress may be there. আমার friend ছিল when I was in hostel. So during our pathology examinations, after every 15 minutes, 20 minutes, he used to go to the bathroom. Oh, all this noise making. So this is due to stress. I told you what are you doing? So this is like that. But so it is not the sign of health. Health means you must be in a complete state of complete physical, mental, and social well-being. There is another domain people now is saying, but it does not come in the definition called spiritual well-being. I am coming to that, but that does not mean religion. Spiritual means. And there is an operational definition. That means it means, sir, this definition is abstract definition. How to make it operational? I will make it. To make people healthy, you have to make operational. Okay. To make the people of Bolpur community, the Birbhum community, or West Bengal, or India, etc., etc., you have to make an operational definition. That is, health is a state of body and mind in which there is no obvious evidence of disease and the person is functioning normally. So, normally means that is within normal limits of variations of standards of health. Variations of standards of health, height, physical height, etc., your genetic makeup, etc., etc. Okay. So, all are not said. Everybody is different in this world. Our DNA, our genetic makeup, everybody is different. Okay. Plus and plus. But sometimes some similarity is there. Similarity in the relatives, similarity in the brothers, sisters, etc., parents, etc. But that doesn't mean all are different. Generally accepted for one's age. So that means the standards of health, various standards of health are not acting normally as per one's age. একটা বাচ্চা যে কাজ করতে পারবে, একটা বড় তো পারবে না। As per one's age, sex, male, female, সমান কাজ করতে পারবে না। Community and geographic regions. Community also differs. Differs also geographical regions. And the various organs of the body are functioning adequately in themselves and relation to one or the organs. So our different systems are there in the body. Human body is very, very complex, very, very still. So many things are not yet described. It is coming day by day, especially central nervous system, etc. So many day by day new things are coming up. All these things are functions. It is very difficult. Say, crores and crores of cells are there. They are biological, physiological, and all those things different. So for this reason, you have to learn a bit all. I always used to say, actually, in our society, Indian society, in our time also there, now also there. Of course, nowadays a bit different. In our time, at that time higher secondary was there, higher secondary, class 11 was there. So in higher secondary and all those things, who are at the top of the, after examination, they used to do the medical. Okay. But they are not going to the core subjects, physics, chemistry and all those things, other different disciplines. You see, frankly speaking, meritorious students should go the core subjects. All of us are meritorious. That does not mean that average level, all those, they come to the medical science, because here there is no core subjects you have to learn. You have to learn all subjects a bit and become a skillful physicians. That is clinically, interventionally, you have to do good, surgically, all those things. So that you have to learn. So আমাদের একজন স্যার বলতো, আরে মেডিকেল সায়েন্স তো একটা সাবজেক্ট, নট ফর মেরিট। ওকে, সো দ্যাট মিনস সো মেনি সাবজেক্টস আর দেয়ার ইন মেডিকেল সায়েন্স। আমাদের সময় তো ছিল না, ইট হ্যাজ এক্সপ্যান্ডেড। ইউ হ্যাভ টু নোট এভরিথিং এ বিট সুপারফিশিয়ালি। সো in community medicine also, so many things are there. You have to know everything a bit superficially. Even in our discipline also, in medicine also, they will discuss disease. We also will discuss disease. So overlapping will be also there. Someone in medical, general medicine, they may discuss to you tuberculosis. We also do tuberculosis. But we will give much more importance in prevention and control. Because community medicine, though nowadays treatment also part of the community medicine, but it is much more of preventive medicine. Okay, because treatment also a part of prevention. You will understand all those things. Early diagnosis and treatment, just to make you a bit of curious and interesting. You see, during our time or before that, oh, you have cancer, no answer. Cancer means no answer. One will die within, actually that was like that, within 5 years or so. Now so much, if you do early diagnosis, 100%. All of you know the Angelina Jolie. Her breast is, because she is carrying a bit gene, hereditary gene. So she was not suffering from breast cancer. But considering that she may suffer from breast cancer, she has done the radical mastectomy. You may not be knowing. So many females in your side by side going on day by day. 100%. Nowadays, plastic surgery and all those things, breast development can be done. So you cannot understand all those things. Okay. So that means why I am giving these examples. Early diagnosis, very, very important. If you do as early as possible, all these things. It is used to say, number one treatable cancer in this world, breast cancer. And what is number one preventable cancer? আস্তে আস্তে জানবে, তোমরা এখন জানো না। If you know, what do you know? Your cervix? Cervix? What is cervix? In female genital organs, uterus, then cervix, then vagina. So there is cervical cancer. So cervical cancer used to do by a virus, HPV virus, it is human papilloma virus. So it is 100% preventable if you maintain personal hygiene, if you maintain faithful sex, your sex partners may be faithful, all these things. So you may not suffer from cervical cancer. But this is most prevalent especially in developing countries like India, because nowadays it has been a bit, because educated society, urban society, they use sanitary pads. But even in rural areas, they don't use sanitary pads. They use different types of cloths, etc., and all those stuff that may not be clean. Okay, so this is like that. So part of the early diagnosis, we will discuss all those in the levels of prevention. Early diagnosis treatment also part of the prevention. So you will remember, you understand health. So you have seen, so physically, mentally, socially, you have to understand all those things. So we call, there is subdomains of health. 3 subdomains you can answer, or somebody may say 4 subdomains. Now one is physical subdomain. I have called physical well-being. In the previous slide, I have shown physical well-being. So physical means various parameters related to anatomical your structure. Your physiology means what? In simple term, what is physiology of the body? Function of the body, the function of the cell. Always remember, when physiology may turn into pathology, then your disease develops. Some physiological changes going on in the tissues or organs may not be symptomatic because already pathological damage has not done. When pathological damage done, then your disease symptoms are there. So if you early diagnosis during physiological, all these things. So physiologically and your genetic makeups, okay. So the person which are normal limits and functioning in normal equilibrium. So this is physical domain or physical well-being. That is, you have to structurally, anatomically you must be well-being, physiologically you must be well-being, and genetically you must feel well-being. Physical subdomain. Mental subdomain. Mental subdomain means person is at peace with himself or herself. You must be peace with himself or herself. What is going on? I used to say in our educated society also, in our friends also. Maybe having one car. I have to 4 cars. I have to. You are living in a good flat. I want more flats. So we are not satisfied. I am feeling you. People used to say, I am not making most of it. I am not telling my age, but you can guess my age because I am retired from central government. So you can easily guess my age. In India now, all central government for all retired at the age of 65. তোমরা নিউজ পেপার পড়বে, সব জানবে, বহুদিন আগে হয়ে গেছে। সবাই 65 পর অনলি হু আর মেডিকেল টিচার্স দে ইউজ টু গেস, কারণ এই প্রাইভেট মেডিকেল কলেজ আমাদের ছাড়া চলবে না। সো ইউ ক্যান গেস মাই এজ, অল দিস থিংস, এন্ড আমি আর বেশি দিন নেই এখানে, আমিও চলে যাই হোক। ডক্টর স্বপন ভট্টাচার্য অলসো he will turn 70 in this month. Okay, so they used to say, hey, don't think that, আরে তোকে তো এখন আগে বিয়ের পিড়িতে বসানো যায়। I used to say, I am at peace myself. আমার আর কি দরকার? I was in central government, I was director in All India Institute of Hygiene and Public Health. I mean, central government salary was there. So I may not, maybe I am having one car, one flat is there. But why to make more? Our children are less, 1 or 2. Why people becoming so much of stress and strain running for money? I don't understand it. Frankly speaking, our fathers and mothers used to have 5, 6, 7 children. But in our time, everyone, all of your brothers and sisters, how many? You may be 1, you may be 2. I don't know, maximum 3. How much is required? And all youngs, all our sons and daughters in service earning money. So most you don't know, if your society, plenty of crores of money is in the banks, even our offspring don't know. So people not peace at herself. If you are at peace, go make friends, laugh, gossip, discuss so many things, you will be at peace. Okay. And with the society, you have to peace at with the society, social members, your neighbors, your relatives, etc. in the society, and is able to take day-to-day stress without undergoing breakdown. As I am telling you, my friend, during pathology examinations, what happened? That is a breakdown. Why it is a breakdown? Exam is there. I studied a lot. Yes, I will answer as much as I am possible. Examiner also knows nobody can answer 100%. So if you can answer 50%, if you answer 60%, you will pass. What is the harm? Okay. So why do you get breakdown? So if you remain peace, so whether maybe my genetic makeup is like that, but frankly speaking, I am really at peace. Always. It is my since our school days all like that. I have so many. I lost my father when I was at the age of 10 or like that, 10, 11 like that. After that, I have grown so much in my cousin's house, etc., etc. So I got so much of trouble and struggle I have done, but I am at peace. Okay. I don't think I was number 1 house staff in obstetrics and gynecology, and I don't know whether you know the book, you will be able to know. Professor C.S. Das Gynae at that time, C.S. Da, he used to make, at that time it was very much popular. Now উনি মারা গেছেন, so the book is not that much popular. So I was his senior house staff. But ultimately I turned into public health. যদি বলো কেন? Not yes, in my domain. Actually, I used to, at that time when we have passed, you have seen, you know MTP Act. Do you know what is MTP? Medical termination of pregnancy. It has become legalized in 1971 or 72, like that. Huh? 71. After that, amendment are there, but in 1970 it is legalized. And at that time, because at that time you are not born, so in Calcutta, in every maybe 500 meters or 300 kilometers, one abortion clinic was there. And people used to do abortion, I mean, in 20 rupees, 30 rupees at that time. So I think that even some of the fetus are a bit more. My friends used to make it, I mean, after abortion, they turned it down on the tray. That means যাতে আমার একটু খারাপ লাগছিল, but I am very much was skilled in obstetrics and gynecology. তাহলে আমার দ্বারা obstetrics gynecology হবে না, মানুষকে মারবো কেন? একটা বাচ্চা, you have not right, আমাকে কিন্তু people are doing. Now up to 24 weeks of pregnancy it is legalized. So even 24 weeks fetus is actually living. সবই করছে. So I turned into, I'm happy. If I was in obstetrics and gynecology, I maybe would have been earned much more, crores of rupees. But that is not required. So I am mentally at peace. So you have to decide in yourself in your future. Okay. Social subdomain. Person is at peace with other members of the community and contributes to the development of the society. We have some role in the family, society. Everything will not be done by the government, etc. Everybody in this country, in this world, has some do some contribution to the society. Okay. If you aware them, say some good things, some advice, that is also contribution to the society. Okay. But we are not following. So this is the society, all those things. You have heard that Singapore and all those things are very clean city. Or we can say when metro came, metro is very much considered. Well, people are not making it dirty. It is everybody's all, but we are making it dirty. We are spitting everywhere. We are throwing our, I mean, by the side of all these things. So many, everything. It is our responsibility. So social people, I am at peace. So I am at peace with the other members of the society. Oh. Spiritual subdomain. People are nowadays, this is the discussions going on, but it has not come in the definition of a health. But if you say, nobody will mind. Spiritual subdomain, it is not related to any religion. It is not related to you are going to the temples and mosque like that. It is, person is love for nature and feels responsible for caring human beings, animals and the environment. You must have something also. You must have fulfilled all this nature, for the animals, for the environment. You must have something. And spiritual practice is also very important in maintenance of health and prevention of the disease. We will discuss all those. So many things are, diseases are due to the environmental factors and all those things. Social factors. I have told you this is a segment, our lifespan, as you are telling, 70, 71. But what is the average lifespan of Japan? There are some islands in Japan, you will be astonished to know, all are above 100. All are above 100. Okay, Japan and Japanese society and all those in Scandinavian, European, most of the European countries, it is 90 or like that. And we are also, our governments are very much anxious. What is the senior citizen population in India now? Do you have any idea? Senior citizen means above 60 years. Around 8 to 9%. It is said that after 10 years, it will become 15%. Government are very much anxious because in India, 1 or 2% of out of 140 or 40 crores is much more. Absolute number is much more. Is it not? I used to say, always think about it. You know the price of Mercedes-Benz, etc., car. So why Mercedes-Benz so much anxious to come in India? Because if 0.5% of population or 0.01% of population buys Mercedes car, that is lucrative to them, because 0.5% of total population becomes a number. It is 140 crore population in the world. For this reason, everybody wants to come in India. Understand? So absolute number is much more. So nowadays we are very much thinking about geriatric population like us, because so many government, it is in the paper, it is there on the paper, but people are thinking, discussion is going on, but that it is a burden coming to the society in future, because lifespan is increasing, our old age population also all things. Geriatric medicine is developed, some are doing, I don't know nowadays, geriatric medicine post-graduation is there, people are doing it because in future it will be a lucrative one, but people are doing geriatric and all those things. Geriatric, you understand? Geriatrics means the subject related to the old age, right? So all these the subdomains of public health. A bit, ecology and health. Modern concept of community medicine or medical science is that health is seen as a part of total ecosystem. We have to know, I told you that we have to know everything, but we have to know, understand. As you know, what is ecology? Ecology is defined as total setting, is ecology. Total setting in the human beings in their complete environment. Not only physical environment. What is physical environment? Examples of physical environment. এখানে physical environment কি? Air, noise, illumination, these are physical environment. Okay. And what is, and also chemical environment. What is chemical environment? Gases, etc. Exhaust. You are exhaling, you are inhaling, so many gases are there, and all those things are there. At the outside, all the gases, and in the dust particles, so many chemicals are there. Okay, when you go to the roads, different exhaust fumes and etc. Air become polluted, water become polluted, chemical agents are there, pesticides are there. So many examples. And biological. Biological means, what is the biological example? Biological environment? Bacteria, virus, parasites, plenty of here. Thousands of viruses there. As you know. In the dust it is there, in the air it is there, bacterium, all those things there. So we take, it is called, you take precautions. In Corona used to, so many diseases, respiratory diseases are used to, so we ask people to wear masks, so that you cannot spread it and you cannot inhale it. Okay. So biological and socio-cultural, socio-environment, very important in old environment. If people remaining poverty, so how can you look after your health? If people are not able to take balanced diet, ideal diet, quantity and quality wise both. So socio-cultural, and in cultural, so many practices are there. Nowadays we used to say after birth of the baby, not a drop of water is required. It is for the last 20 years or so. We are always using. Don't give anything. Still culture is there. Some give some honey. Some gives জলপড়া বলে, I mean all those things. Maybe by priest or mosque, Molovis, etc. and all those things. But it is not required. Scientifically it is not required. So these are the cultural practices. Some are doing some things. After delivery, in the rural areas, they are keeping separate near, I mean, and they making it dirty because they, but no, it should be 100% clean. Thinking in our society still, I am telling you, pregnancy is a disease. What is it? If anybody say what is pregnancy? Menstruation is a disease. What is it? Answer ta ki hobe scientifically? It is a physiological process. So pregnancy is also a physiological process. Is there any difference in the Indian pregnancy with that of American pregnancy? No. But in our country, so much of maternal mortality, child mortality. This is our ignorance and all those things. That is not only in the educated society and in the people living in the lower socio-economic environment, socio-cultural and all those things. Okay. So ecology is concerned with all the interactions human beings are various factors, physical, etc., and all those things. Okay, so it is called overall system. Health actually nowadays a bit change is there. You can see, we always do say in a bit of here previous times. Nowadays that doctors are responsible for health of the individual. No, doctors only part of it. If you say in the hospital also, doctors are there, nurses are there, everybody is there, responsibility always there. Clerks are there, I mean group D staffs are there, cleaners are there, sweepers are there, everything. I mean pharmacists are there, all are responsible. Again, in the community also, health is the overall responsibility, all these things. And health is being affected, but not only by only bacteria, virus, etc. Other socio-cultural factors. So many diseases nowadays are coming up. You will nowadays understand. We call it communicable diseases. What is communicable disease? Which communicates. Those diseases caused by bacteria, virus, etc. Corona is a communicable disease. Even influenza is communicable disease, and all those things. Malaria, etc., etc. Non-communicable diseases. Examples of non-communicable diseases. Not only cancer, cardiovascular diseases. In our country, still communicable disease burden is much more about, but we are also coming. But in Western countries, non-communicable diseases are much more. WHO is now defined accidents also in the non-communicable diseases. Very large subject, non-communicable diseases. Okay, so non-communicable diseases are there. So that means this. Why accidents? Because accidents, our traffics and our all these things are not properly maintained. So accidents are there. Right? That. So for these reasons, it is a total ecosystem, I mean socio-cultural and all those systems, right? So it is called health is the holistic aspect. Some of the terms in community medicine he always used to say comprehensive, holistic, etc. That is all the scientific concepts of health recognizing the strength of all social, economic, political, environmental influences. So it is called that health is affected not merely by bacteria, virus, or maybe not taking junk food, etc. All these things. It is a whole socio-economic environment. People are suffering from lung cancer. We can't 100% ban that, but it is decreasing all those things. So if suppose cigarettes and bidis were not born, not manufactured, so lung cancer will be there. If air pollution is not there, lung cancer would have been there. No, it is not that there. There are several aspects are there. You can say why it is not banned. There is a separate issue because crores of people are engaged in that business. We cannot 100% ban them, their production, etc. But that means, so diseases are due not only for yourself only, these are due to the effect of total ecosystem. Your total environmental systems, socio-cultural systems, legalized systems, etc., and all those things, etc., etc., etc. You can say that yes, in that city, not that much of accidents are there. So that means if my city, that much of accidents are there, that is legal actions are not that much strong. So if you take proper legal action, that will be not strong. If you take proper action, then you cannot sell cigarette to a boy of 18 years or below. It is actually legal is there, but it is not possible. So like that, so we are not doing actions. So for these reasons, always remember health is the total that community medicine teaches us. Right? So I will not discuss today much. We will discuss maybe at least a bit of community medicine you have to know. So community is a group of individuals living in maybe in the villages, blocks, towns, districts, municipal or corporation area. That may be a community. And community medicine is maybe defined as a branch of medical science which addresses health promotion. We will discuss all those things. Promoting your health, disease prevention, health restoration by treatment, curative steps, and rehabilitation. Rehabilitation means I may be suffers, I may be handicapped due to polio, but I may be properly, I am not that discarded in the society. I can be given that much of work which I can perform. In our friends are there, maybe polio affected, very good surgeon, maybe all those things. So accordingly, so rehabilitation, so many things. Leprosy and all those after these able to rehabilitation. So accordingly, you call for his earning, for his day-to-day work service, you rehabilitate them accordingly. As you see, rehabilitation of hawkers, it is called like that. Community medicine is applied for the overall delivery of public health care to the defined community using the various tools and techniques of broad disciplines of public health like epidemiology, jeta we will discuss to you, environmental science, entomology, microbiology, biostatistics, etc., etc. So in our subjects, you have to learn a bit of statistics. You have to learn it, fundamental statistics, because you have to make reports. You have to go to the survey, and this statistics it will require in your postgraduate course. When in postgraduate you have to do thesis. Fundamental statistics is required. Okay. Okay. Sorry, it is okay. So this is about community medicine. So actually, somebody may ask you what is the basic difference with the public health. Previously, public health. Public health it is used called the mother science, main science. So and community medicine, why the name has been changed from public health to community medicine, so that we have to take public health management. We are doing health promotive activities, promotion of health. How can you promote health? Examples are there. If you ask your mother to give breastfeeding, he will be a healthy baby. If you ask our municipality area to give safe drinking water to all, they will be suffering from all those things. If you ask people to, make personal hygiene before food and after defecation, you will be astonished to know these are the disciplines. 60 to 70% of gastrointestinal diseases are due to remaining unhealthy. Not maintaining hygiene. Okay, so it is not our habit. We always giving it in the mouth. So before taking food, always clean your hands. And there are called 6 or 7 steps of washing hands and all like that. And especially after using toilet, etc., etc. If you do, so you will not make suffer from plenty of things. You can take balanced diet and all those things, proper all those things. What is available in your food? That will plenty of things you can learn in the community medicine. But that is not doing. I am telling you that is due to the ignorance. People are buying apple. Do you know? From before, rather than apple, a guava is much more nutritious than an apple. But we are buying Australian apples from our malls, Australian, New Zealand apples, etc. 400, 500 rupees per kilo. But you can get country guava. They are full of vitamins and minerals, especially vitamin C. We are not taking amloki. There are plenty of, but we are taking chabanprash and all this making that. But amloki is fresh. The vitamin C is a heat level and all these things. So it is not that bad. So all these things. What is available in our society, we are not taking it. That is due to our ignorance. Okay. If we are not, we can make people to understand that before preparation of food, you wash the vegetables and fruits properly in a total whole form. এরপরে ক্লাস তো নেই তো ফিজিওলজি ডিপার্টমেন্ট ভিজিট না visit, okay. So you can take all those things. This makes people health promotion and all those things. Okay, we'll discuss on all those things. And preventive actions. You can take preventive actions if you give drinking water supply, safe drinking. I am telling you one thing before finishing. As a Government of India nominee, in 2005 I went to Sweden, Government of India. So when I reached there, actually from India, 4 doctors and 4 nursing personnel were there to improve the overall maternal and child health system of India. So it was a collaboration. So I reached there at night. Separately, people came from Ahmedabad, Bombay, etc., etc. Separately, people. I reached Stockholm, and when I reached Stockholm at night, so I entered my hotel room. In the counter, I have just signed, and he has given me the now the key. You know, the key to card. Card is the key in the hotel room. I entered it. Very small room, and there are all these things. I have seen that there is no water bottle there. I took up the phone and ask the reception counter, hello madam, can you send me a bottle of water? Why bottle of water? I have to drink it. He asked me, don't you have a glass in your room? Yes, one glass is there. You see, there is a tap in your room. I no, there is no, in the room there is no toilet. I go to the toilet, and by the side of my commode there is a tap. Will take water from there. She told me at that time, I learned a lot. She told me, any tap where anywhere in Sweden is 100% safe drinking water. That is the achievement. We are making plenty of these things, crores and crores of rupees, but we are not thinking that at least we send every house all these things. And it is, except some of the big 1 or 2 companies, all are mainly adulterated. I have made it, and it went to the I have made the project in our All India Institute. I have sent it to the parliament. I am not naming the companies which are it is safe, because so many all these things there. People are not we are taking it. This is the problem. So if we supply, say, I am telling you why this story, because if you supply, if you ask your students to make safe drinking water, plenty of gastrointestinal disease will not be there. That is the, community medicine. Right? In most of the African countries and etc., due to the development of community medicine, they are, but their curative system is not that much developed. In our country also, it is developing for heart operations and all those things, plenty of all these things. But you can do a much better result if you improve community medicine in and apply in the principles in the society. But our political system and our governments are not evolving. There are separate issues are there. You have to learn it. We cannot say always all these things, because there are so many things are there. Okay, simple things in community medicine do a lot havoc. As I have told you, washing, asking people to take and all those things, to take meals, etc., to have drinking water. Okay, so we will take and subject wise. Today I have given you some ideas and all those things. If you have any query, you may ask you. May not be for the first day, but don't be ashamed to ask questions anywhere to your teacher. Not in my discipline, for other discipline also. Okay, always ask questions and discuss among yourselves.
So in physiology, we are yet to start classes, right? Okay, your anatomy and biochemistry classes started? Okay, according to syllabus, right? Okay, so yesterday we talked about few rules and regulations of our institution, your NMC, competency based medical education. What does a competency mean, and how to deal with the competencies? What are certifiable competencies? So I guess all of you are aware of that, right? Okay, by today I have also shared an Excel link, right? A Google Sheet link. I guess you are getting in your WhatsApp group. So there you can see all the classes in advance, at least 3 to 4 days in advance. What are the practical classes that we are going to conduct in next few days, and what are the theory classes that we are going to conduct in next few days, right? Okay. And also we will include the courses which are specified under foundation course, which has been specified by NMC. So there are lots of things under foundation course, like what does it mean to be an IMG? What is IMG? Indian Medical Graduate, right? So what are the roles and responsibilities of IMG, or Indian Medical Graduate? A little bit of history of medicine and alternate system of medicine that are prevalent in India, right? And also a few ethical aspects, right? Few ethical aspects, few medical legal aspects, and all the healthcare delivery system in India, starting from your primary health center, the community health center, and the tertiary care hospitals, right? Like a medical college. So the structure of healthcare delivery system in India, and all the things related to community health, it will be dealt under the Department of Community Medicine, right? and there are also few topics under your foundation course like stress management and role of yoga and stress management, right? Okay, so these things are important because we had talked yesterday that the pressure, the burden in MBBS curriculum is really huge, and every day I will try to make you more a medical student than a 10+2 student, right? Because the leap is big, the jump is big, right? And the transition is huge, right? And you need to be adopt yourself in this environment, in this curriculum, okay? And also simultaneously you need to maintain the rules and regulation of the campus and the institution, okay? So there definitely in the course of your curriculum, with pressure of your study, sometimes the pressure of your duties, right? And many a times there are lots of family issues, so these things will keep on going, right? These things will keep on coming and going, right? There might be few breakdowns, right? You may find someone for your support, right? Definitely these things happens, right? And this is quite okay to find someone, right? But always remember, try to maintain decency in the college campus, right? Respect your seniors, respect your faculties and all the college staffs, right? Because you know they deserve it, right? Okay, anyway, I'm moving on to my topic. So I'll be starting with your cardiovascular system, right? So a prerequisite for cardiovascular system is body fluid distribution. Unless and until you know the body fluid distribution and water balance, right, you will not be able to understand cardiovascular system properly, right? So again, I am not considering today's as a class, right? So again, we are continuing the formal interaction, right? And with this formal interaction, I will tell few things, right? Okay, and that are basic, very fundamental to understand medicine and to understand physiology and medicine, right? So why understanding or the concept of body fluid distribution or water balance is required? Because many a times we face in our wards, in our ICUs and in our hospital setup, definitely we end up with deliberate use of fluid infusion. It might be in the form of normal saline, it might be in the form of ringer lactate, okay? So the knowledge of body fluid distribution is essential, because you need to understand how much fluid I need to infuse to the patient, right? Many times it may be a patient of dehydration, it may be a patient of hypovolemic shock, it may be a patient of hemorrhagic shock, right? So how much fluid you need to transfuse and when you need to stop, and what are the choices of fluids, right? Whether I should transfuse ringer lactate or dextrose solution or normal saline. So to decide, you need a precise knowledge of body fluid distribution and what happens with the osmolarity, okay? So the knowledge of body fluid distribution and the knowledge of osmolarity will go simultaneously, okay? If you are to understand all together, you need to understand osmolarity and you need to understand the water balance, right? Okay, so first let us start with body fluid distribution, okay? Body fluid distribution, I guess yesterday our HOD sir has told a little bit on body fluid distribution, right? Yes or no? Okay. Okay, so for a 70 kg healthy resting individual, 70 kg healthy resting individual, body fluid is 60% of total body weight, okay? 60% of total body weight. So say for example myself, right? So say for example or assume that I am 70 kg, right? So I am 70 kg, right? So how much will be my body water? 60% of total body weight, 60% of body weight, that is 42 kg, right? 42 kg. Now, don't immediately come to liters, right? So 42 kg. So I am 70 kg, and out of this 70 kg, 42 kg I am water, okay? So I have 42 kgs of water in my body, right? Okay, now as you know, at 4 degrees centigrade NTP or STP, whatever, you know that 1 kg of water is volume will be 1 liter, right? But our body temperature is not 4 degrees centigrade or not in STP like that, right? Okay, but still we don't need that much precise calculation for physics and chemistry. Okay, so we can assume that 42 kg is equal to 42 liters, right? Not exactly, if you as because you are just from physics background or chemistry background, so we don't need that precise calculation over here, right? So 42 kg we can assume as 42 liters, right? So I have 42 liters of water in my body, right? Now out of this 42 liters of water, majority is within the cell or outside the cell? Majority of the fluid is within the cell or outside the cell? Okay, some of you are telling that it is outside, some of you inside. Okay. So out of this 42 liters, some part is intracellular fluid, right? ICF, and some part is ECF, extracellular fluid, right? Intracellular fluid and extracellular fluid. Now out of this 42 liters, 28 liter, okay, 28 liter is intracellular fluid and 14 liter is extracellular fluid. How much will be in percentages? 40% and 60%, right? So 60% will be intracellular fluid within the cell, 60%. So majority is intracellular. Majority of the fluid volume is intracellular. Remaining 14 liter or remaining 2/3 or remaining 40% is extracellular fluid. Now everything that is happening with fluid balance is directly linked to extracellular fluid volume. This 14 liter. This 14 liter is our maximum headache. Okay. Whatever we are doing with the patients in the IPD or ICUs or ward, right? Whatever we are doing with the patient, we are just playing with this ECF, this 14 liter. This 14 liter is our major concern, because this 14 liter or extracellular fluid volume, it is maintaining your mean arterial pressure, it is maintaining your perfusion pressure, right? So if you vomit, or if someone is having diarrhea, or if someone is having RTA or road traffic accident, right? So the immediate fluid loss is not from ICF, not from intracellular fluid. You don't lose fluid immediately from inside your cell, right? You lose fluid from outside, that is extracellular fluid, right? And this extracellular fluid is our major concern. Okay, in subsequent classes, I'll teach you that extracellular fluid volume or ECFV, this 14 liter is assumptions. 14 liter is for a 70 kg human being. It may vary depending on patient's body weight, patient's body surface area, right? So on an average, it is 14 liter, and this 14 liter is our concern because it maintains your mean arterial pressure, right? So because we are just discussing, it is a holistic approach. So as I am mentioning the term mean arterial pressure repeatedly, mean arterial blood pressure. What is mean arterial blood pressure? Anybody, any idea? What is mean arterial blood pressure? And why it is so important? Why we are not considering systolic pressure, diastolic pressure, but we are much more concerned with MAP or MABP, mean arterial blood pressure. Why? Yes? Okay, how to calculate mean arterial pressure? Anyone? How to calculate mean arterial pressure? I'm trying to give you the concept. Okay, so right, I was discussing body fluid distribution, the intracellular fluid volume, the extracellular fluid volume, and you have, by now you have the knowledge that whenever we lose fluid from our body in the form of dehydration, in the form of hemorrhage, right, in the form of vomiting, whatever, okay, in the form of excessive sweating even, right. So we lose fluid from that 14 liter and not from 28 liter. That 28 liter is initially preserved, okay. That 28 liter is usually at the beginning it is constant, right, but you lose fluid from this 14 liter. And what will happen if you lose 14 from this 14 liter? Say for example your ECF volume, instead of 14 liter it is coming down to 10 liter, 9 liter, 8 liter, what will happen? Okay, so I will discuss all these things in subsequent classes. But the thing what I am already telling you, that if you lose if you lose extracellular fluid volume, you will immediately lose your mean arterial blood pressure, right? Not immediately, your body tries to some extent to maintain mean arterial blood pressure by some homeostatic mechanism. Again, I am introducing a new term, homeostasis. What is homeostasis? Okay, homeostasis is the term. The term was introduced by a physiologist, Dr. W.B. Cannon, right, in the year 1901, right. And homeostasis means maintenance of normal environment when it is subjected to change, right. So your body has got a homeostatic mechanism for all the parameters. It may be your body temperature, it may be your blood sugar, it may be your blood sodium level, it may be your blood potassium level, right, and even it may be your mean arterial blood pressure, right. So whenever your mean arterial blood pressure is dropping, your body automatically tries to compensate somewhat by doing vasoconstriction, by activating some reflexes, right. So say for example my mean arterial blood pressure is 90 millimeter of mercury, right, and I am having some dehydration in the form of diarrhea or vomiting or whatever, excessive sweating, right. Okay, so I am losing from my 14 liter. So my mean arterial blood pressure will tend to fall, but my body will protect myself by doing some homeostatic mechanism, right. And those homeostatic mechanisms might be some reflexes like baroreceptor reflex, chemoreceptor reflex. I'll teach you what is baroreceptor reflex and chemoreceptor reflex in subsequent classes, okay, and by doing some vasoconstriction. Okay, so my body will try to maintain mean arterial blood pressure. Even if I am losing 1 liter or 2 liter blood, I will maintain myself conscious with the help of this homeostatic mechanism. But if you lose this homeostatic mechanism, someone might get unconscious immediately, right. Okay, now this is homeostasis. Homeostasis, again, remember the definition, it is the maintenance of normal environment when it is subjected to change. Okay, I'm just quoting the line from Gannon's textbooks of physiology. So it has been written that homeostasis is the term coined by W.B. Cannon, and it is the maintenance or restoration of normal environment when it is subjected to change, right. Restoration of normal environment when it is subjected to change. Okay, it happens similarly in case of all parameters. Say for example your blood glucose is sufficiently low, right, due to some reason you have not taken food, right, you are in a stressful condition, right, so your blood glucose is low somewhat, right, but you are not losing consciousness, or you are not collapsing, right. So what is happening? Your body is maintaining your blood glucose level. How? By activating neoglucogenesis, by activating glycogenolysis, right. You know all these things. What is neoglucogenesis? What is glycogenolysis, right? Okay, so your body is breaking down glycogen from your liver, from your muscle, and synthesizing glucose, right? And also activating neoglucogenesis, right? Okay, that is happening in liver, right? So similarly, every parameter is regulated, right? Say for example, your temperature is being high due to some viral infection, but initially your body tries to compensate it, right? Okay, by increasing your thirst so that you intake more water and activating the system in the urinary tract so that extra temperature or extra heat goes away, right? Okay, so everywhere there is a homeostatic mechanism, be it your temperature, be it your mean arterial blood pressure, be it your blood glucose, everywhere there is a homeostatic mechanism, and homeostasis is the restoration of normal environment when it is subjected to change. Now again, come back to our topic, that is mean arterial blood pressure. So I told you, if extracellular fluid volume is somewhat low due to any reason, right? So the tendency will be your mean arterial blood pressure will fall, right? So what is mean arterial blood pressure and why it is falling with dropping of extracellular fluid volume? Okay, so if I say in a healthy resting individual, systolic blood pressure is 120 millimeter of mercury and diastolic blood pressure is 80 millimeter of mercury. Now you calculate what will be the mean arterial blood pressure. Okay, so you are telling 100, right? So 120, 80, 120 is your SBP and 80 is your DBP, right? And I am asking you what is mean arterial blood pressure. You are just simply adding up these two pressures and dividing it by 2, right? And making it average. Okay, this is not mean arterial blood pressure. Why? This is not mean arterial blood pressure, and your answer is absolutely wrong. Why? This is because you know, but you are not applying your concept. You already know. I guess you already know. You know cardiac cycle. Okay. So if my heartbeat is 72 beats per minute, say for example, not always. Okay. So 72 per minute. How much is the length of the cardiac cycle? 0.8 second. How did you calculate it? How did you calculate it? 0.8 second. Are you are telling 0.8 second and you don't know how to calculate. My heart is beating 72 times in a minute, in 60 seconds. So for a single bit, 60 by 72.8, right? Okay. So for a single bit, it takes 0.8 second, right? Okay. So 72 bits, okay, it needs 60-second time, right? So one bit, 60 by 72, that is 0.8 second. This is the length of the cardiac cycle, right? So one cardiac cycle, it consists of two events. What? Systole and diastole. Okay. So if we talk about systole and diastole, we do not mean atrial systole and atrial diastole. We mean ventricular systole and ventricular diastole, the bigger chambers. We talk about, whenever we are talking about systole and diastole, okay. So conventionally, if we talk about systole and diastole, it definitely means ventricular systole and ventricular diastole. Okay. To mean atrial systole and diastole, we need to utter separately atrial systole and atrial diastole, right? But conventionally, if we are talking about systole and diastole, it is definitely meaning ventricular systole and ventricular diastole. Do you know the duration? Systole 0.3 second and diastole 0.5 second, right? So this is the length of systole and diastole, that altogether 0.8 second. Clear? Had it been 0.4 plus 0.4, jodi eta hoto, had it been 0.4 plus 0.4, systole plus diastole, your answer would have been correct. Mean arterial blood pressure is equal to 80 plus 120 by 2, that is 100, right? So when the length of systole and diastole is not similar, how can we average it, right? So mean arterial blood pressure means throughout the cardiac cycle, the mean pressure. I am giving you the concept, right? The concept is this. This is your LV. LV means left ventricle, right? Left ventricle. So from left ventricle, aorta, right? Aorta. Further, arteries, large arteries, small arteries, arterioles, capillaries, right? So this is the division. So LV is a part of your systemic circulation, which sends blood to your system, to your body, right? To your brain, to your extremities, to your lungs, liver, everywhere, right? So aorta or your left ventricle is ejecting blood through your body, excepting one organ, that is lung, because this is not a left ventricle's job. Okay, to pump blood in lung is the responsibility of right ventricle, RV. Okay, So LV function is to pump out blood to all your organs except lung, right? Okay. So this is your LV and it is ejecting blood into the systemic circulation. So grossly we have two different circulation, one is systemic circulation and another is pulmonary circulation. Two different circuit, systemic circuit and pulmonary circuit. Though these two circuits are in parallel, two parallel circuit, right? Okay. Now assume, I will not do it or we will not do it to a patient, right? Assume we are inserting a manometer, a micromanometer inside the LV and connecting it to a manometer. So inserting a cannula into the left ventricular cavity and connect it to a manometer, right? Manometer means to measure pressure simply, right? So I am inserting a cannula, connecting it to a manometer. Then what will be the pressure recording? I am giving you the complete setup. I am inserting a cannula in the aorta, connected to a manometer. I am inserting a cannula into the arch of aorta, right? Connecting to a manometer. Into the small arteries, connecting to a manometer. Into arterioles, connected to a manometer. Into the capillaries, connecting it to a manometer. How will be the pressure? Everywhere, 120/80, 120/80 everywhere. No, not everywhere 120/80. In the aorta, right? In the aorta, this fluctuation will be 120/80, 120/80, 120/80. This fluctuation will be there, right? Then after arch of aorta, this fluctuation will fall down, right? The fluctuations will be less, right? So it will fluctuate, see, around the middle part here, right? Okay. And if you go more peripherally into the radial artery, into digital artery, right? A capillary is in your finger, right? So there will be a single pressure, there will be no fluctuation, and that line is your MAP, mean arterial pressure. Clear? So as we are moving distally from the left ventricle, that fluctuation will be less, right? Fluctuation will be less. Initially in the aorta, it will be 120/80, 120/80, and you go more peripherally. Say for example, from arch of aorta, you are going to subclavian artery. Again, you see 120/80 into brachial artery, 120/80, 120/80, radial artery, still 120/80. Then more peripherally, right? Digital artery, that fluctuation is less. Okay, so it is showing an average value, a mean value, not average value, a mean value, right? And you need to calculate that mean value. And more peripherally, most peripherally, in a capillary, right? In a capillary, it is a straight line. Okay, not zero, but it is showing a mean value, right? Okay. Okay, one question, how much will be the fluctuation over here, LV? This top part is 120, this is 80, right? And here, inside LV, it is 120/0, because when your LV is relaxing, the pressure inside is 0, right? When your LV is relaxing, pressure inside is 0. So what is the cause of this diastolic pressure 80? Because of the elastic recoil of the aorta. Okay, even during diastole it relaxes back, right? And it creates the pressure on the blood column, right? It is called Windkessel effect, right? So because of the presence of elastic tissues, collagen, right? Your aorta recoils, right? Aorta recoils, and this is the basis of diastolic blood pressure, generation of diastolic blood pressure. But if you are inside the LV, you will feel no pressure, absolutely no pressure during diastole, right? So inside the LV, pressure is 120/0. Inside the aorta, pressure is 120/80. right? And you move more peripherally in a digital artery, or say for example in capillary, if you insert the manometer, it will show a single value, say for example 90 millimeter of mercury, somewhat between 120 and 80. Okay. Now you need to calculate that mean value. Okay. So here is 120 and here is 80, right? So here is 100. Okay, this is dBp, this is SBP, right? And you have seen that diastole is more, 0.5 second, right? And systole is 0.3 second, right? So mean arterial pressure will be somewhat towards diastolic blood pressure, because its influence is more on mean arterial pressure, because it is 0.5 second, right? It is 0.5 second, it is more, and 0.3 second it is less, right? So mean arterial pressure will be towards, not exactly at the midpoint. Had it been 0.4 and 0.4, then mean arterial blood pressure would have been 100, right? But as because the influence of diastolic blood pressure on mean arterial blood pressure is more, right? Because it is 0.5 second duration, right? So mean arterial blood pressure will shift from midline, and somewhat here will be the value of mean arterial pressure, right? Okay. So this was our initial challenge to calculate mean arterial blood pressure. And if you were to exactly calculate mean arterial pressure, you need to integrate, right? Simply you need to integrate. Okay, integration 0 to 0.3 PdP plus integration 0.3 to 0.5 PdP, right? In this way, you need to calculate mean arterial pressure, right? But now it has been seen that as because the influence of diastolic blood pressure is more, so you can calculate influence of systolic blood pressure 1/3, right? And influence of diastolic blood pressure 2/3. Okay. So the formula of mean arterial pressure is dBp plus 1/3 of pp. Okay, diastolic blood pressure plus 1/3 of pulse pressure, that is 80 plus 1/3 into 40. So it comes to 93.3 millimeter of mercury. Who is not getting? Everyone okay with this? What is pp? Pulse pressure. Pulse pressure is the difference between systolic and diastolic blood pressure, right? So if you simplify it, if you just simplify it, just make it more simple. So diastolic blood pressure plus 1/3 into pulse pressure. Instead of pulse pressure, I am writing systolic blood pressure minus diastolic blood pressure, right? So dBp plus SBP by 3 minus dBp by 3, right? Okay, so SBP by 3 plus 2 by 3 dBp. Okay, so 1/3 of systolic blood pressure and 2/3 of diastolic blood pressure, as because influence of diastolic blood pressure is more.
So today, anyway, we will start abruptly with a topic, but we will go a little slow till we get the full strength. So before that, I just want to make sure how many of you do not understand Bengali at all. Big hands. I want big hands so that I can count. 1, 2, 3, 4, 5, 6. From Odisha, Bhubaneswar. Bihar. Yeah. One more from there. UP. Which part? Kanpur. Jaunpur. why you felt like I have never heard of that place? When you are asked some question, you should be always louder enough so that the person who is asking, he can listen. Otherwise, what is the point of answering? Huh? Kanpur, fine. So the Orissa people might be understanding Bangla a little bit, but for Bihar, I doubt, and UP definitely not understanding. For you, the first thing should be to learn local language. Even though we'll conduct classes in English, but many times, since majority is Bengali, and many of you are from Bengali medium, I hope so. So they can demand, that is also logical, that why can't you explain the same thing in Bangla, isn't it? Now, with me, there is no problem. But sometimes you will find some teachers who are not from the state, they cannot speak in Bangla. So we will speak in Bangla in between, and we will try to translate the same thing. Always remember, those who don't understand Bangla, they are not going to miss any information, since it is extensively or exclusively given in Bangla. No, that won't be. It will always be translated whenever it is required. So that much tolerance should be there. With tolerance, we are Indians. Without tolerance, we are Pakistani, Taliban. With tolerance, we are Indians. Without tolerance, we are anywhere you want. There are many places. Why not say Israel, Ukraine, Russia? They are not tolerant. Both are equally intolerant. Palestine, everyone. They are intolerant. You go to Egypt, they are intolerant. You go to Saudi Arab, they are intolerant. You go to Africa, they are intolerant. But tolerance is a whole and soul criteria for being Indian. And that is the only thing by which we are known in the world. Very fine. So very soon you will be taught about the foundation course which will be taken in between. So we are going to start. Actually, your syllabus starts with cell and cellular cellular components, etc. But we will start with carbohydrate. So we go very slow. I told the reason before. Carbohydrates, they say, most of you have studied about carbohydrate in +2. If you are from CBSE board, then you have studied probably more than what I have studied at your age. Correct? Since he has agreed that he has studied more than what I studied at his age, so please stand up. You are from? Kolkata, কোন স্কুল? ব্যারাকপুরা, ওদের ব্যারাকপুরা কলকাতা বলিস না, ব্যারাকপুর যাও, ঠিক আছে। হ্যাঁ, ব্যারাকপুরা নরেন্দ্রপুর যদি কলকাতা হয় তাহলে আর বলার কিছু নেই। ক্লাসে আছি, পরে ফোন করছি। So according to, what is your name? Swapno? Swapnil Biswas, very good, very beautiful name. So Swapnil, according to your Biswas, your belief, what could be a carbohydrate? Do you think this is a carbohydrate? Think now, what is there to think? Okay, carbohydrate. Now explain why it is carbohydrate. That's all. C6H.
No, this glucose. This is tetrodotic.
Glucose is a carbohydrate, but does it mean glucose is the only carbohydrate? Yes, there are many humming. Yes. Anyone wants to put little more light? Anyone else? Go ahead. Let's try. Let's see how far. What is your knowledge? Sarah? Anyone? Quickly. Your teacher? Carbohydrate is made up of carbon, hydrogen, and oxygen. But graphite. Raffinose is the only. What you said by mistake, actually it's type of carbohydrate. Anyway, so rhamnose is not a carbohydrate. Anyone else you want to put little bits? Something new? Yes? Something new? No. Anyone else? Go ahead, give a try. Try. Always stand up and say. There are so many compounds who are made of carbohydrate and oxygen. Even the plastic polythene also made of the same thing. Yes, carbohydrates. See? Don't look at me. I am not as handsome as Shah Rukh Khan. Look at the board. Correct, then? Am I right? What you have studied and what you have uttered, there is a compound made up of carbon, hydrogen, oxygen. This is, you should have left as soon as you joined any graduation course. Up to class 12, this can be tolerated. Now you must remember this one. And according to this is carbohydrate, this is carbohydrate. Cotton is carbohydrate. Carbohydrate, correct? So all are, we are surrounded by carbohydrates. These plywoods, these cotton threads, everything which is made up of cotton, clothings are carbohydrate. The rice, chapati, bajra, jowar, everything, they contain carbohydrate. So they came up with this particular definition has got two parts. The first part says that all compounds which has more than one hydroxy group and more than one hydroxy group and one aldehyde or keto group. So together this aldehyde or keto group we call carbonyl compounds, carbonyl groups. If you have not forgotten the chemistry completely by this time. Remember, you must remember some chemistry till you have subjects like biochemistry, pharmacology. After that, you can throw away your chemistry book to whichever river you pass by. Okay, but beyond that, till then, you should remember a little bit of chemistry. Correct? So the first part says any aldehyde or ketones which has more than one double bond are carbohydrate. But the problem is we eat starch, we wear clothes made up of carbohydrate. These are not those which fall in this criteria. The first part. For those compounds which are multiple units of monosaccharides, say disaccharide, polysaccharide, oligosaccharide, for them the second part. Or the compounds which produce the same, means what? The first part. polyhydroxyaldehyde or ketone on hydrolysis. Clear? So now this complete definition encompasses all the compounds which are carbohydrate. Here nowhere it is mentioned that whether it should give energy or not, whether it should be a type, it should be a component of food or not. Definitely this is carbohydrate, but we cannot eat it. We can eat, but we cannot digest it. So those kind of carbohydrates are called dietary fibers, which are there in the diet, which has got some significance in our health, but we cannot harness any energy out of it. আমরা তাতে কোনো এনার্জি পাই না, তাই না? তোর খুব খিদে পেয়েছে, দুদিন খাসনি, তোকে আমি একটা কাগজ ছিঁড়ে খেতে বললাম, এনার্জি পাবি না। গাছের পাতা দিয়ে দুটো কাঁঠাল পাতা, কচি কচি কাঁঠাল পাতা দিলাম, খা, খেলে এনার্জি পাবি না, তাই তো? কিন্তু একটা আম দিলে খেলে এনার্জি পাবি, একটা আপেল দিলে একটু এনার্জি পাবি, তাই তো? তার মানে অ্যাপেল, ম্যাঙ্গো, দে কন্টেন সামথিং which provides energy. Correct? বোঝা গেল? So by definition this is carbohydrate. Now when it comes to classification of biomolecules, when I say biomolecules, we refer to a group of compounds found in biological system. Huh? So how many types of biomolecules you know, madam? One is carbohydrate, another is proteins, another is lipids, another is nucleic acids. We have only 4 types of biomolecules. Only 4 types of whatever compound around us in biological system must fall in these 4 components types. এর বাইরে কিছু নেই, অন্তত আজ পর্যন্ত পৃথিবীতে আবিষ্কার হয়নি। এবং আমরা যখন এক্সট্রাটেরেস্ট্রিয়াল লাইফ খুঁজতে যাই তখন আমরা এইগুলি নিয়েই যাই। যদি এক্সট্রাটেরেস্ট্রিয়াল লাইফে এইগুলি বাইরে কিছু থেকে থাকে, we won't be able to identify it. ঠিক আছে? তাহলে when it comes to classification of carbohydrate, initially if you go back to say 15-20 years back, the textbooks, they have given only 3 segments: monosaccharides, oligosaccharides and polysaccharides. Later on it was found that disaccharide encompasses a huge number of compounds which has got many utilities in our medical field. So they coined a new classification separately for disaccharide. So monosaccharide, disaccharide, oligosaccharide and polysaccharide. Now how do you classify on basis of what? On the basis of number of saccharide units. শর্করা ইউনিটের উপরে ভিত্তি করে আমরা এটা ডিফাইন করি। এবার যদি আমাকে বাংলায় পড়াতে হয় সেটা আমার পক্ষে বেশি মানে কষ্টকর অ্যাকচুয়ালি। আমি বাংলা ভুলে গেছি। হ্যাঁ, বলতে গেলে বাংলা ঠিক আছে, কিন্তু লিখতে গেলে বাংলা লিখতে গেলে আমার এখনো প্রবলেম হয়। কয়েকদিন আগে একটা কর্পোরেশনে চিঠি লিখতে গিয়ে সেটা খুব ভালোভাবে টের পেয়েছি। চিঠি লেটারগুলো মনে করতে পারছি না, আসছে মাথায় কিন্তু লিখতে পারছি না। কেন? অনেকদিন অভ্যাস নেই। আর তারপর সবচেয়ে বড় বদ অভ্যাস হচ্ছে আমাদের বোর্ডে লিখে অভ্যাস, তো পেন ধরলে এখন হাত কাঁপে। পেন দিয়ে খালি সইটা করতে পারি চেক বইতে, তাই না? যাও, তা monosaccharide মানে হচ্ছে those compounds which cannot be hydrolyzed to a simpler saccharide unit or simpler carbohydrate, যাকে তার থেকে সরলতর কোনো কার্বোহাইড্রেটে আমরা ভাঙতে পারবো না। Monosaccharides are those which cannot be hydrolyzed to a simpler form of carbohydrate. Disaccharides, which are when hydrolyzed, they produce 2 sugar units or saccharide units. Oligosaccharides between 3 to 10 units. Polysaccharide, which contains more than 10 subunits, more than 10 sugar units. Correct? Clear? Now, if I ask you some examples of monosaccharides, glucose, fructose, galactose, mannose, xylose, xylulose, arabinose. Disaccharides? Sucrose, lactose, huh? Sucrose, lactose, maltose, তিনটে হলো আর গ্যালাক্টোজ মনোস্যাকারাইড বাবা ল্যাকটোজ মাল্টোজ সুক্রোজ এই তিনটে হলো আরেকটা তো বলা উচিত জোরে বল মাইকোজ ম্যানোজ মনোস্যাকারাইড আরেকটা বলা উচিত যদি হায়ার সেকেন্ডারি পাস করে থাকে ভালো হবে আইসোমাল্টোজ বলা হয়েছিল আইসোমাল্টোজ বলা হয়েছিল ঠিক আছে আরেকটা এক্সপেক্ট করতাম একটু ভালো স্টুডেন্ট হলে সেলোবায়োস অ্যাটলিস্ট 4টে হয় সেলোবায়োস বলতো তো নয় ট্রিহালোস বলতো এই দুটোর মধ্যে একটা বললেও বলতে পারতো অ্যাটলিস্ট এই 5টা আমি আশা করেছিলাম ঠিক আছে যাক তাহলে অলিগোস্যাকারাইড আর বেরোবে না if there are 3 sugar units we call it trisaccharide or triose triose or trisaccharide triose how many of you think it is trisaccharide a sugar containing 3 sugar units should be called a trisaccharide how many of you please raise your hand no one Achha. How many of you think it should be called triose? People are always in the wrong side. The sugar which contain 3 saccharide units, they are called trisaccharide. Triose means 3 carbon atoms. Correct? Classification of monosaccharides. Monosaccharides can be classified based on the functional group present. So there are 2 types of functional group. One is aldehyde group, another is keto group. If they contain aldehyde group, they are called aldoses. If they contain keto group, they are called ketoses. If it is aldose sugar, the aldehyde group should be present in the terminal carbon atoms and it should be numbered as lowest as 1. If it is a keto group, then keto group cannot be at terminal carbon atom because it requires at least 1 methyl group preceding it. So it should be at least C2, correct? So if it is aldose, then aldehyde group will be at C1. If it is ketose, then keto group will be at C2. Clear? Example, glucose is an aldose sugar, fructose is a keto sugar. Keto sugar. Or you say ketose. Either you say aldose sugar, or you say aldose, or you say keto sugar, or you say ketose. Like ছোটখাটো terminology. হ্যাঁ একজন শিক্ষিত অশিক্ষিত এবং উচ্চ শিক্ষিত তিনজনের মধ্যে ডিফারেন্স করার জন্য হ্যাঁ বল আচ্ছা হ্যালো তো দেখো কিটোজে আরো কতগুলো এক্সাম্পল দেওয়া আছে ফ্রাক্টোজ দেওয়া আছে রাইবিউলোজ দেওয়া আছে রাইবিউলোজ কে নাম শুনেছো আগে জাইলোজে কে কে নাম শুনেছো আগে? ম্যানোজের নাম কে কে শুনেছো আগে? কার কার বাবা অপথলমোলজিস্ট? বাবা অপথলমোলজিস্ট, বাবাকে জিজ্ঞেস করবে ম্যানোজে কি ব্যবহার, বলবে ম্যানোজের একটা ফর্মে ব্যবহার হয়, তাই না? এরকম আর কি জানতে হবে, ইন্টারেস্টিং। স্ট্রাকচার দেওয়া আছে, বেসিক স্ট্রাকচার, ওপেন চেইন স্ট্রাকচার, বা এই স্ট্রাকচার আরেকটা নামও আছে, কেমিক্যাল নাম। কি ধরনের স্ট্রাকচার বলে এটাকে? কি ধরনের প্রজেকশন বলা হয়? ফিশার প্রজেকশন, গুড। ফিশার, এমিল ফিশার এটা দিয়েছিল, তাই তো? তাহলে স্ট্রেট চেইন, ওপেন চেইন ফর্ম। গ্লুকোজের ক্ষেত্রে C1 এ অ্যালডিহাইড গ্রুপ আছে, C2 তে একটা হাইড্রক্সি গ্রুপ আছে, C3 তে আছে, C4 এ আছে, C5 এ আছে, C6 এও আছে, তাই তো? এর মধ্যে কোন কোন কার্বন, কোন কোন কার্বনে হ্যাঁ অ্যাসিমেট্রিক কার্বন বলা যেতে পারে, বা কাইরাইডি রয়েছে? হ্যাঁ, কোন কোন কার্বনে কাইরাল সেন্টার রয়েছে? টু, 3, 4, 5, পাঁচটায়, কারেক্ট? এই ক্ষেত্রে তিনটে, 3, 4, 5, কারেক্ট। আরেকটা কি জিনিস আছে, দুটো স্ট্রাকচারের মধ্যে ডিসিমিলারিটি কোথায় আছে? C1 আর C2, C1 আর C2 ডিসিমিলারিটি মানে পার্থক্য, কি বলে, হ্যাঁ পার্থক্য, হ্যাঁ। আর সিমিলারিটি কোথায় আছে? 3 থেকে পড়ে এগুলো, তাই না? তাহলে দেখ 3 এর হাইড্রক্সিল গ্রুপটা বাঁদিকে অন লেফট হ্যান্ড সাইড, 4 and 5 অন রাইট হ্যান্ড সাইড, 6 নাম্বারে রাইট হ্যান্ড সাইড লেফট হ্যান্ড সাইড হওয়া সম্ভব? সম্ভব না। কেন? Carbon's 4 hands are not satisfied by 4 different groups, তাই তো? Now classification of monosaccharide based on number of carbon atoms. স্টার্টিং করতে হচ্ছে 3টে থেকে। কেন 3 থেকে, 2 থেকে নয় কেন? ডায়োস নয় কেন, ট্রায়োস কেন হলো? কে বলতে পারবে? হু ক্যান আনসার ওয়াই দ্য স্মলেস্ট কার্বোহাইড্রেট ইজ নট ডায়োস, ইট ইজ অলওয়েজ ট্রায়োস? কে বলতে পারবে? বলো। কার্বন হবে না? কি বলছিস? এটা কারণ হলো কার্ল কার্বন না থাকে, কার্বোহাইড্রেট ডেফিনিশন লেখা আছে কোথাও কার্ল কার্বন হতে হবে? হ্যাঁ দাঁড়া, হ্যাঁ বল। রিং স্ট্রাকচার আর ফ্রম দ্য ডেফিনেশন পলিহাইড্রক্সি, যদি দুটো হয় 2C হয় তাহলে পলিহাইড্রক্সি হবে? Therefore diose cannot be a sugar. আচ্ছা, what do you think, fatty acid is water soluble or not? হাত তুল বল, ইজি কোশ্চেন তো। Fatty acid, is fatty acid water soluble? Yes. হ্যাঁ, বিফোর দাঁড়িয়ে বল না, স্ট্যান্ড আপ। লাইন, fatty acid is acid soluble. acid soluble নয় বসো you don't know that. My question is fatty acid water soluble? No. What is the smallest fatty acid? What is the name of smallest fatty acid? দাঁড়িয়ে বল জোরে বল হ্যাঁ গ্লিসারাইড আবার কি অন্য হয়ে গেল রাবণ হয়ে গেল বল বিশাল অন্য জিনিস হয়ে গেল এনিওয়ান স্মলেস্ট ফ্যাটি অ্যাসিড অ্যাসিটিক অ্যাসিড and it is water soluble, example vinegar. But beyond that, when it becomes propionic acid, still it is water soluble. When it becomes butanoic acid, still it is water soluble. But beyond that, solubility decreases. By the time it becomes 8, 10, 12, 14, 16, 18, 20, 22, 24, 26 carbon containing fatty acid, it becomes completely water insoluble. Correct? So these type of things are always present. So acetic acid is a fatty acid, but it is water soluble. It is the smallest fatty acid. Correct? Now, can you remember these names? I remember once in first professional Viva, one sir came from Bihar, state of Bihar, external, and he asked, name one glucose sugar. And none of the student could answer. The question was so simple. You should always think about the simplest of the simple questions. Yes, always start from the bottom and go slowly. So, glucodocose, glucononose, glucooctose, glucoheptose. Right? So, remember the names. Next, disaccharides. Can we classify disaccharides? We cannot classify disaccharides based on their structural features. We can only classify disaccharides based on their functional features. What is that? The disaccharide can be made up of, see, suppose glucose and fructose, can they form a disaccharide? Yes or no? Yes. What is the compound? একেবারে যাতা অবস্থা সুক্রোজ এটা মানে sucrose, correct? So in the sucrose, which two carbon atoms are joined? C1 of glucose and C2 of. Now, if you can go back, have you ever heard a reagent called Fehling's reagent? Huh? Heard of it? What is the use of it? What do we detect by that? Aldehyde ketone na. Both aldehyde and ketone will answer same Fehling's test. I don't know. To identify presence of carbonyl group, rather, it is reducing property. If the compound is having reducing property or not, এইটা আমরা বিচার করি. Whether compound is reducing or not. The similar test is present, which is called Benedict test. Right? Same, similar test. Benedict test. Barfoed test, all are similar tests, slightly different. Here, if glucose and fructose, they combine with C1 and C2, then all the carbonyl group containing carbon atoms are occupied by the bond formation. So, they cannot reduce the copper sulfate present in the solution. Hence, they cannot show any reducing property. So, disaccharides are classified based on this, whether they can reduce Benedict's reagent, Felling's reagent, or they cannot. If they can, we call it reducing sugars. If they cannot, we call it non-reducing disaccharides. So in non-reducing disaccharides, the linkages should be made between the carbon atoms of carbonyl groups. Clear? And in reducing disaccharides, one of the reducing ends should be remained free. So the reducing disaccharides are examples: maltose, isomaltose, lactose. Correct? Non-reducing, how many of you know about this? Anyone? At least one who used to like zoology very much? No one? Strange. Three halos. Have you heard of a group of animals called arthropods, insects? So in their body, what do you call the body fluid? Do you call it blood, or do you have a separate name? Lymph. I am not asking about the pigment, blood pigment. So the insects, they have hemolymph. Now, in our blood, have you ever seen any person going for blood sugar estimation, blood glucose estimation? Have you seen? So what is the significance of blood glucose in our body? What is the use? What does it do to our body? Provides energy. From cell to cell it is transported and it provides energy. Similarly, for insects, the same function is carried out by tree halos. Only difference is our glucose is monosaccharide, not required to be digested, can directly be used and metabolized. And for them, they have to first digest it by tree halase enzyme, and then use it as glucose. So tree halose is made up of 2 units of glucose units. Glucose plus glucose joined at which carbon? Which carbon it should join? 2 molecules of glucose to make tree halose non-reducing? C1 and C1. Which carbon should be joined to make it a sucrose? This compound C1 and C2. Clear? This is the structure of maltose. 2 sugar units joined by a linkage. In between there is a oxygen. Now these type of linkages are called a special name, glycosidic. Correct? Glycosidic linkages. Now these 2 linkages, what is the difference? One is called alpha glycosidic linkage and this is called beta glycosidic linkage. Why? We will see later. Okay? But for the time being, you should know that they are structurally 2 different. We require 2 different types of enzymes to cleave. We have alpha amylase in our body. We do not have beta amylase. These are made up of beta glycosidic linkage. We can eat, but we cannot digest. Alpha amylase can digest alpha glycosidic linkages between alpha 1 and alpha and 4 alpha 1 4 glycosidic linkage. Whatever it is there. but it can cleave only in alpha glycosyl linkages. And we have alpha amylase. We do not have beta amylase. So who do have beta amylase? Wrong. Only bacteria. Herbivores. Cow is like our mother. And ox is our father. Bullock is our chacha. And chagol is our masi, auntie. Correct? So whatever it is, they all belong to the same class. We are all mammals. So if one mammal has no beta amylase, how come a second mammal will have beta amylase? They do not have. No herbivorous animal have beta amylase. They rather have a special pocket in their intestine called cecum. Do we have cecum? Do we have cecum? Yes, we do. We do have cecum, but it is very small. If it becomes large, then we need to take the help from surgeon to cut it and remove. Appendicitis. Any inflammation to that part is called appendicitis, and the part is called appendix. It is found in books and is also found in our groin. Right? Sometimes appendix can be found above also. Before the discovery of USG machine, for surgeons it was like opening and looking for where is the appendix. After USG, now we can know where is the appendix. We can go and do the pinhole surgery, or Sopon sir said na, photo surgery. Yeah? So before that, it was not photo surgery; it was kata surgery. They cut the whole abdomen. Sometimes anomaly, the appendix may be present here in the upper part of the cecum, like a colon. So you have to reach from here to cut here to here to find out where is the appendix. Previous olden days, now it is not done. Now the difference is they have particular pouch kind of thing called cecum, where they harvest, or rather they rear up a group of bacteria. The bacteria produce beta amylase enzyme. So if you give cow an antibiotic, clean up her intestine, he will die. No, she will die. Why? Because all the bacteria will die and she cannot digest grass. So you have to feed rice for the time being to the cow. So that slowly the normal natural flora will develop and she will be able to eat grass. Right? So antibiotic is not always life-saving. Sometimes it is fatal. So rather, nowadays you have seen that this concept has come to human being also. Instead of giving antibiotic, they give what? Probiotics. Have you seen small kids when they go to doctor with stomach upset? They don't give antibiotic. They give probiotic. They give rather good bacteria. The kid is suffering from the ailment because of more bad bacteria. So you provide him good bacteria, the bad bacteria will subside and he will recover slowly. That is the concept. Clear? Fine. So they have, this is called cellobiose. This is a portion of cellulose. The same unit, if you increase by number, you will form cellulose. Cellulose is found in here, particularly in the paper. Okay? But paper is contains cellulose anyway. You have cellulose acetate paper also there, cellulose nitrate paper is also there, different types. So the bacteria can digest, not we. Now this one is structure of sucrose. See and remember the structure of sucrose. When you open your book, you might find that this fructose is located beside the glucose molecule. Then you will face a problem in understanding the structure. Everything will change the direction. Why? For the conduciveness in printing, they print in an inverted manner the fructose beside glucose to show that it is beta 1 to glycosidic linkage. So they change, instead of changing the direction of oxygen, this one, they change the direction of this OH will be above, this OH will be below. What do you call these kind of projections? Howard projections. Very good. My job is half done. Oligosaccharide. We will study least about oligosaccharide. Why? Because it is most complicated. We are in first year. In first year, we study only soft things, not very hard things. Oligosaccharide is the most difficult part. There are two types of oligosaccharides based on their linkage with the protein. They are usually found in association with certain proteins. Proteins associated with carbohydrates are called glycoproteins. Proteins associated with carbohydrates are called glycoproteins. So glycoproteins can be of two types, either O-linked or N-linked. O-linked means the proteins containing amino acids which contain hydroxyl group in their side chain, say for example serine, threonine, tyrosine. They might share their hydroxyl group for joining with the carbohydrate part, then we call it O-linked. If amino acids like asparagine, glutamine, lysine, they share their nitrogen group with formation of the oligosaccharide chain, for joining of oligosaccharide chain, we call it N-linked glycosaccharides, N-linked oligosaccharides. What is the role, function? See, in recognition, interaction, and enzyme regulation. N-linked tend to be complex and branched. This is very difficult. Right? So, rest all functions, particularly cell surface attachments and all those complex things, are done by N-linked glycosides, N-linked oligosaccharides. And there are plenty of Ds also. Right? So what are the commonly found sugars? See, asparagine N-linked. This is N-acetyl glucosamine. FUC means fucose, isosugar. NAG, then man means mannose and mannose. And then again NAG, gal, NAN. NAN means. So if it is asked, name one 9 carbon containing monosaccharide, derived monosaccharide. N-acetyl neuraminate is a type of derived nonose. Right? We'll stop here with this slide. Polysaccharides can be of two types. When we hydrolyze polysaccharide, we may get all identical units. We call that homopolysaccharide. If we do not get all units identical, we call it heteropolysaccharide. মানে বাংলায় বললে হলো কি, আমি যেটাকে ভাঙলে একই রকম শর্করা ইউনিট পাই তাকে আমরা বলবো হোমোপলিস্যাকারাইড।